Hey everyone, it's Michael here with Home Health Success Academy and 10xPatientReferrals.com, and welcome to another one of our business podcasts over here at Home Health Success Academy. And our main goal is to be able to, show you guys and share with you interviews as well as conversations we have with a variety of different people, from owners of agencies who is currently existing or they're starting to create an agency. We're going to be speaking to marketers, and at the very same time as we're going to be talking to some of the individuals out there that provide support for agencies, from softwares as well as client support and marketing people. Okay, so in this episode, it's pretty much a talk with one of the marketers out there who's having some questions. And the main goal here is to be able to share with you guys that more likely you're probably having the same problems that some of these marketers are also facing. So our main goal here is to share the information, and maybe that you guys can get some, tips and tricks on some of the conversations that we are having at this very moment. Just to let you know, this podcast is brought to you by a medication reminder program, giving you the one up from the competition. If you provide a medication reminder program for your services, it's going to be able to make you stand out and get you more referrals. Also brought to you by HomeCare which takes care of all your answering for your home care services, home health agency, and hospice 24/7, 365 days out of the year, and even during the holidays. So let us handle all your phone calls, even those late night calls, and stop missing those calls. And of course, 10xPatientReferrals.com provides you all the training you need to be able to be great at marketing your home health, home care, and hospice services. So let's go ahead and get started with this podcast. All right, so we're in, man. So how's everything? Nice to see you, man.
Good to see you too. Okay, so my screen is okay. I gotta focus on this one.
So tell me what worked. Because it's the fact that you got 3 referrals right away within a week for a few of the stuff that you practiced out. What's the one that really worked for you right away?
The follow-up. Follow-up, definitely. Honestly, everything has been working. Like, I just listen to it when I'm in my car. Like, that's all I listen to, like, as I'm driving. So if I feel like I'm getting discouraged or whatever, like, I just think, like, when I'm in the hospital, I think, oh, hey, Michael said, but wait, Michael, you're being selfish. No, if you really believe in the patient care, then you're not being selfish, right?
Yep.
So that's been really been helping me out a lot, and actually going and asking for the referral.
Yeah, I mean, a lot of the times the biggest mistake we do is we do all these presentations, but we don't even ask.
Right.
And the reason why is we just, when we ask that question of a referral, we're just like, am I being too pushy? Am I being too salesy and stuff like that? But the thing though is you're there, right?
Yeah.
The only thing that we don't ask is you don't start asking for a sale when you first meet them. But if you already had the relationship with them and you're ready, you've been there several times, there's nothing wrong with asking that. Like, I'll give you an example. Like, you remember the follow-ups, right? And remember I told you the follow-up system is the most important part. Everyone forgets the part that you presented already. They forget that stuff for some reason. It's the follow-up is when they start knowing you, trusting you, right? Know, like, and trust. And I've had it where, like, remember I told you, as you go through this process, if you're getting new clients or new places that you're visiting, you're going to do a pretty much a 60-day just straight up follow-up system, right? When I hit that pretty much that 8th week of me going there weekly, emailing them, visiting them, phoning them, on that last day, I'm going to ask them, like, listen, doc, I've been here several times, and I hope that you've seen that I'm really passionate about what I'm doing and the business I'm in and the service we're trying to provide your patients and everything. Is there something that I missed? Is there something that I haven't really explained to you yet? And the reason why is I just want to know, like, it's really me putting them in the spot, and they say something like, well, no, you did a good job. Well, great. I'm glad I did a great job, doctor. I mean, so since I did a great job, what else can I give you or talk to you about so that you can actually want to refer to us and give us a try? The reason why we're doing that is, like, I'm going to, how there's that thing that they say is, like, burn the ships, right? You sailed in for the war, right? So what they did is they burned the ship, so there's no backing out on this, right? So having that system, and like, okay, I'm just gonna just give you the whole stuff, and what happens is you kind of guilt them to that, and who cares if you're trying to guilt them, because you already wasted 8 minutes.
That's what I always have in my head. Like, you've already wasted your time. You're getting paid, this much, like $30 an hour. And when you don't bring in a client, when you don't close the sale, then you lose your job. That has been the honestly there's so many things to say. Like, I'm very excited about the program. Like, every part of the sales process, like the videos have really helped with every part of the sales process. So with me calling, with me, when you when in the videos when you say, you have to keep calling, you can't be afraid of calling, people get scared, marketers get scared 50% of the time, they don't even show up. Well, guess what? One of the cardiologist's office that I've just started getting referrals from, I haven't even met the decision maker. I've just been following up, constantly calling for the order. Like, if we're missing something, you say, you have to go get it. If you get a referral, don't just be like, oh, fax it over. I haven't even met the decision maker, but I've been writing notes down. Please write it this way. Thank you so much. I appreciate it. Because they won't even let me through. But even then, I'm still getting referrals because I'm showing up. So that every part of the sales process is really, like, from your videos, I've been trying to apply. I've actually been applying, not trying, and it's worked.
And what I'm going to do for you is actually what's amazing about this, and you're actually going to be, this one hasn't been released yet. We're going to be doing a boot camp all over the U.S. We're actually going to Texas also, right? So we're going to be in Texas, Houston, Austin, Dallas, and San Antonio. So we're planning those are 4 cities we're going to.
Oh, cool.
So since so what we're going to be what we're going to be teaching people on that 1-day marketing training that we're doing, we also created a webinar for it. So for people that are not in the cities we're going, they can actually purchase it. So what I'm going to do, I'm going to have you as one of my trial people to watch the whole thing.
Oh,
so,
thank you.
What I'll do is this: once we have it in place, because it's being edited right now, we just recorded. It's 7 hours worth of stuff. 7 straight hours of talks. That's like 7 hours and 25 minutes. So once it's been edited a little bit and uploaded, it's going to be in a private video section. I'll get you an access to it. So it's like 7 hours straight. So we're charging like $2.99 for that, just for the webinar. I'll let you have access to that. So
thank you.
It's literally it's taking you to the sales process from top to end, like straight up. Like, you're just gonna, all that stuff. So it's like, it's gonna be good for you. So I think that, I think that will help you, because I really want to help you out and make sure that you're doing this stuff. So I mean, yeah. So I'm glad that you talked about the follow-up, because I can't begin to talk about anything about this whole thing. Your follow-up is really where everything's at. That's where, there's that talk where 49% of people don't even come back the second time. And then when you're down to that much amount of people left, and it's funny is there's a whole lot of other people that doesn't even visit that potential company. So
right.
Starts dropping down. And if you're the guy who's hitting these people 8 visits in 8 weeks, in pretty much 2 months, and then you're emailing these people, it becomes a crazy thing. And then later on we can talk about, once you really have the process in place, once you know the closes, the objection blockers, and all that stuff, what ends up happening is you can even start incorporating an email sequence. So, like, for example, my team will use, we used to use Aweber. Now we use, now we're using Builderall, Mailboss. And what we do is, once we enter somebody's email there, we already know they're just going to get the emails constantly.
Right.
So we're like literally following up with them with the email. So that's set. But right now you just need to do it yourself, because you really need to just have the system in place in you and stuff like that. So you're doing the follow-ups of the places that you already had. Just for the fun of it, right? Let's just, like anything else. What were the 2 questions that I kept on hitting you with? The 2 questions you asked. Remember that?
The questions like, oh, Doc, what are the 3 things that?
There you go. So
in a home health agency.
Yeah. So what are the 3 things that made you choose to work with agencies in the past?
Right. I already know that coming in here. I already know that you're working with another agency, Doc.
So right there alone, that's an objection blocker, right? Like, you can't tell me, because the best way to like talk about objection blockers is do you remember the movie 8 Mile? I don't know if you ever saw the 8 Mile.
I've never seen it.
You've never
But I'll watch it now. Netflix or Hulu.
Well, I'll tell you the part that's important, right? So, it's Eminem and the rap battle stuff and everything, right? So towards the end, when he was battling the champion guy, right? He knew that the champion guy is going to talk all these smack about him, all these negative things about him. Mm-hmm. So he knew that from the beginning. So what he did was, when he started his battle rap, he literally said every single thing that the guy's going to say. You're going to call me a white boy. You're going to call me a mama's boy. You're going to say that one of my friends got shot in the foot. You're going to say all this stuff. So he just started saying all the stuff that the guy's going to talk crap about. And once he was done with that, then he hit him with his rap, his attack. The guy couldn't attack him anymore. So it's the same thing with objection blockers. Hey, look, the reason why I'm here is I know you're already working with another agency. Now, I know you're going to tell me that, you're busy at this moment, and I know that. And I just need 30 seconds of your time. So by me just even saying something like that, automatically they're like, okay.
Yes, that has actually worked. That has worked so much, like just putting a time limit. Like when calling, I called, I have an appointment tomorrow with a wound care clinic, and they wouldn't ever let me in person. And I called, not knowing where I was from, and they were like, they kept coming up with objections like, oh, we don't have time to meet with anybody. We don't, it's me, the nurses do the referrals, but we just let the patient choose. And I was like, I understand. I completely understand. I've worked with people that are busy. I've worked with wound care clinics. I just need 2 minutes of your time to get to know you better, get to know your organization better, to see how I can better help you. So, and they're like, oh, okay, let's do, well, what time, when is good for you? And then I thought, okay, I need to narrow it down, like you said, what the day of the week.
Yeah.
So I just picked Wednesday. That was like my first, one of my first appointments. And she was like, what time? And then I almost went back to, well, what's good for you? But I said, you know what? Let's do 12:30. Let's do 12:30. And she said, okay, 12:30. Yeah. So.
And so, so right there alone, you went bold there, because you're like, I'm telling you it's 12:30, right? You went bold. So if you go bold and say, you know what, all right, it's 12:30, right? It's 12:30. What you're going to do next is like, is there any other reason that you're not going to be able to see me at 12:30?
Right.
Narrow it down. And remember, the reason why we're doing that is like, oh, let me look at my calendar, right? Because sometimes they say they're looking at their calendar, but they're not. Or sometimes they're just talking to you and they're really not. And so you're just really just going deep in it, right? So, what's going to work for you? In the beginning process, you just hit Wednesday, right? You told them Wednesday. So that's what we call like straight up, like bold. I'm going to go straight for you, right? So you're being aggressive. And what's funny is there's nothing wrong being aggressive. There's nothing wrong by being aggressive. Like you said, you realize, I'm like, oh, well, what works for you? You right away knew that you're not going to do that, right? So you went straight bold in. Now, if sometimes you might have one of those days where you're just like, I'm just not a bold person right now. I don't have the energy right now. So then you can say like, hey, what works for you? Wednesday, Thursday, Friday. If today's Tuesday, which one works for you? Wednesday, Thursday, Friday. Right. So it's the three. Think about when you purchase your cell phone plan. Anytime that you go anywhere, right? It's called the power of threes. Meaning, if you buy a cell phone plan, they're going to say, do you want the $29, the $39, or the $59 rate? And most of the time you choose the one in the middle. Right. Same thing when it comes to a stall. When you go into a bathroom sometimes and you're just like, when there's only one, you're like, oh crap, I'm stuck with one. But sometimes you like the options. If there's three, guaranteed. This is the funny part. They literally say that the number one used stall is always the middle stall. Right. But never the first stall. So it's always going to be the middle or the last one. That's why the medium popcorn is actually not that great of a, or actually, wait, what is it? The medium, keep going. I understand what you're saying. I get what you're saying. Yeah, exactly. You would rather choose the medium or the extra large than the small. Right. Because, you're just like, so that's what they always do. That's why really the truth is the best deal is always the grande. Mm-hmm. We're in Starbucks, right? The grande is the best deal. And that's just it, because you're not, because number one is it's the better price. It's not so small. You got enough that you drank, and then you don't feel bad if you drink the venti and you're like, oh crap, I took too many calories. Obviously, I drink a lot of things, but it doesn't really matter, right? So you give them three choices. And so if you're not feeling bold like you did, which is, the fact that in the beginning, now that you're learning, you went bold, that's perfect. Because I would rather have you be bold and go back in the medium part rather than be in the negative, the least aggressive stuff, you know?
And what really makes me go bold is just thinking about you saying you believe in the care that you give, and Kindred is a great company, so why not? So then that's what makes me go bold. You know what? We're gonna do this. We're gonna do this. Yeah. But yes, there's some times where I don't feel that great, and then I think no, I still gotta do it. I still gotta do it. But so yeah, every video has really helped out that way. So that plays into the when I'm making appointments and I'm feeling like kind of shy, then I think, oh no, I need to do this, you know, for the patient, because that's the one who benefits from the close.
It really is.
So
the patient is going to benefit and stuff like that.
Yeah.
But that's a great thing, because you're like, I'm going to take care of the patient, but also be like, you know, at any given point when you're there, the referral source is your patient right now. Believe in the product, that if you sell a product, the company is going to provide good care. Fine. You have to believe in the product to, you know, to purchase something. But your job is not to take care of the patient. Your job is to take care of the referral source. So make sure that they're the ones that you're addressing. So you know, okay, so the first question, right, like we talked about, you know, what are 2 things that made you choose to work with agencies in the past, right? Don't forget the part where you say the past. The reason why we're doing that is because we're pretty much what they call future pacing. And future pacing is me literally telling the person they're the past.
Like,
right?
wait, they're future pacing is telling the person.
I'm future pacing, meaning that I'm pretty much planting in their head that the agencies you worked with that you chose is in the past. So what made you work with those agencies in the past?
Got it. Okay.
So they're like, oh, past. Okay, so it's just me planting it in there, you know. And then we'll go to the part of the second question. Great, thank you so much for sharing with me. That's amazing information. Now, if those agencies in the past can improve something to better care for your patients, but the most important thing is to take care of you, what would those be? You know, and that's what we'll kind of hit on. And then remember, we're talking about closing techniques and stuff like that. And, you know, there's that thing in the movie Death of the Salesman, or the book The Death of the Salesman, where they say ABCs, right? Always be closing. So we are literally closing at every single moment. So if they say something like, you know, they're perfect, well, great thing, you know, appreciate it. So remember, every time they give you an objection, right, that means you were able to bring it up yourself, right? So if they give you an objection, well, they're perfect. Oh, they never make a mistake. Oh, that's amazing. So you always, every time an objection comes in, always address it, right? Be like, all right, hey, that's great that they're always perfect. Now, you know, what we always believe in this is that perfection can be graded, and there's nothing such thing as a full perfection. And if you don't mind me asking, from a rating of 0 to 10, 10 being the most perfect, they never made a single mistake, and 0, they make a mistake a lot, how would you rate their perfection? Right? So when I say something like that, they're going to be like, well, they're a 7, or they're an 8. Because right there alone, I broke the belief of saying that there's no such thing as perfection. But since we're saying they're perfect, let's do this. So if they say an 8, once they say an 8, I already know that they're not perfect.
Right.
If they say a 9, I know they're not perfect. Okay? So if they say, let's say a 9, great. I'm glad that they score a 9 in perfection scale. What would make it a 10? So then it makes them realize, okay, well, what did they make a mistake on then? So by me, they're still going to give the answer of what they do wrong.
Right. Okay.
So it's just me. Seriously, I'm not going to take a no for you. I'm really going to go hit now. So that's the main thing. It's just, this is our introduction, right? This is the qualifying section of the whole, because we haven't presented them yet. So, you know, prospecting is us trying to find out who's our ideal target, you know, using Trello and all that stuff. Once we start figure out who we are, we attack them. Now when we walk in, we need to go past the gatekeeper. We can get past them once we're talking to the right person. Now we're qualifying. Is this person a good fit for us, really? And the mindset that I have when I'm marketing, once I know this is the company I want, the mindset I have is like, you need me.
Right.
I don't need you. So by having that, even though the truth is we need them, but if I have the mindset that I'm above you, that you need me, you need my services, you need me because I'm going to help your life, I'm going to make it easy, I'm going to make you less calls for you, you're calling one person, you need me. So by me having that mindset, It's like, okay, fine. What can I do for you? How can I help you? How can I make your life better? Right? So that's where you have. So, and then if you're in the presenting phase, you need to. So remember, I talk about future pacing a lot. So when we start talking about future pacing, one of the the best part in any presentation is storytelling. So so when somebody says, for example, so you have to think about times where the companies have done something or you've done something. So I'll say something like, talk about communication. I'm like, instead of me saying, oh, we have this, and that as our communication strategy, we have this number. So I'll say something like, imagine this, it's Friday, it's about to be, almost end of the day, and you really need to get a hold of somebody right away. So the best way to do it is like in the past, a lot of companies that work with us, that love my services, that love working with us, all they have to do is call this number. And what's funny is, I've had it where clients will text message me and they know what to do. They know that just text messaging me, I'm going to call them back right away. If you need to get a hold of the company, just call this number. But the truth is, I want to make your life easier. So this is my number. This is my, you can text message me here. You can do this for me and I'll respond to you right away. I want you to be just like the people that I serve, that I help out. They know my number. Now, for any marketer out there that's new, for example, right? Now you have contacts with them already, but even if it's new, the purpose of that is saying like, listen, I have my number. I'm not lying, right? People that wants to get a hold of me has my number. It's me. I don't believe in lying. I believe in using right words. My friends text message me when they get a hold of me. They have my number. People that I work with, I didn't say that the companies, you see what I'm saying? You can use different words to make sense of you. So you're not lying. Because the thing though is once you start lying to people, it does kind of show. And we don't want that to really show, So, and that's the thing. So one thing nice about you is that the company does a good job. So you're not scared about that. So that's a good thing. So now it's just really just getting in front of the right people and really making sure that you're able to talk. So just, like once again, I gave you the 2 questions, right? You have to really know that stuff. Let me ask this question. Do you prefer me to text message you both questions to make it easier?
Sure. Yes.
Okay. I'll text message you those questions so that you have it always and stuff like that with you. And I'm glad that when you're driving, you're listening to it, to a lot of stuff that we're doing. And the reason for that is that's the main purpose of it really is like, let me listen to a quick video from a drive from one facility to one facility. Because the purpose of that is, it's like, okay, all right, like something new. I always tell people the best things to always listen to is the objections and the closing between those. Exactly. Because all you need really, like I know some marketers that we train, they just love 5 different closing techniques. That's all that they want. They learn 5 closing techniques and they just vary it up as they go from facility to facility. I have some marketers that will strictly do all the closes in one facility, always. And they use the same exact stuff. And the funny part about that is, some people are going to say, well, that's like a script thing. That's like, I'm like, no, it's not. And the next thing is, it's not like this decision maker heard the same thing from the other. Because every time you go to somebody else, it's still new to them. And most of the marketers in our industry do not use closing techniques. It's always presentations, always pushing. That's why in our websites, in any home health agency websites that you see right now, it's always just, let me tell you about our services. Let me tell you about our services. Whereas if the agency decide to say, hey, when you go to their website, they say, hey, are you looking for services for a loved one or are you a service provider? Click which button works for you. Because what happens is if the websites do that, for example, and they're a service provider, it should go to a website that talks about how you can service this provider. If you're looking for services, like a loved one, and you click the button, it should go to a part where you start asking questions. I'm like, hey, what's important for you? What are 3 things that would make you choose? So remember the 2 questions, right? I'm gonna do the same exact thing. What are 3 things that will make you choose to work with a company to take care of your loved ones? So that's actually used for the home care stuff or anything. What would make, so then they're gonna say what they want, 1, 2, 3, 4, whatever. So you see how it goes? It's part of the whole sales. It's us finding out about them. So that's what you just need to do. So make sure when you're going to these places that you do that. Now, for the place that they're giving you referrals, but they're not, the decision maker's not there. The question I have there is, do you know the name of the decision maker?
Yes, I do.
Okay, so decision maker, is it the doctor or is it the office team?
It's one person who's by the doctor's side at all times, and that reminds me, it's not always the doctor. It could be someone.
It's never the doctor.
Yeah.
You need to speak to the doctor. No, you don't. I mean, it's fine. We'll include him just to make him happy in this little presentation, because really that's where it goes. But really, it's, how can you make the life of the person he says refer them?
Right. And so yeah, his name is this particular clinic. He kept writing the orders so horribly incorrectly that we couldn't take them. Like, it would say something in, just discharge, or like home health. That's all it would say. Or it'd be like home health, cardio, rehab. And I'm like, oh my gosh, no, we need skilled nursing. Also, we need PTOT eval, because our kindred likes it a certain way, and it's whatever. We just have to figure out how to get them to do that, right? So then he kept doing that over and over, doing it incorrectly. So I finally wrote a letter and I said, thank you so much. I appreciate it. Thank you for referring this patient. Everything's good to go. However, please write, no, what did I put? Put something nice. I put, we need the order to read like this. If every order reads like this, then they're covered for everything.
Yeah.
Even for our cardiopulmonary program.
Yeah.
Please fax over to blah, 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 blah. But then I called again, and then I said, hey, I know I put fax over, but I can also just stop by and pick it up, whatever's easier for you. Well, then they just faxed it over. So
yeah. So
I went on and on, but that was just very exciting for me.
One thing you can do, and this is the fun thing, is like make a fake, telephone order. Right. So.
Okay.
What you're gonna do is, so the typical, physician order, for example. So what I'll do is, like, I'll make a fake script or something. Like, I'll use like Canva or something like that. I use Photoshop. I'll put a little script, I'll put Dr. So-and-so, whatever. And I'll write the order, be like, blah, blah, blah. And then you can put like a little thing like, hey, when you attach it to your email, or you can put it in the body of your email, be like, this is, instead of doing this, do this. This is how we want to see. So it's more visual. So it's not just like a quick email. So one thing we teach people when it comes to emails is that, have you ever received emails where there's like pictures, videos in it and stuff like that? Right? That's exactly how it should be set up, where, hey, I'm trying to make it easy for you. Right? So not this. And so, and that's just kind of making things a little bit better, because each people that we deal with have different types of learning types. You have visual, you have auditory people, there's kinesthetic people. So we're just trying to reach everything as we can. So, that's just the main thing that you have to kind of, get into. Now, the software that you guys are using, start using that, right? Using that for your advantage, because now you know who you have. So, remember I said, for now, let's just do it 50, right? Let's just do 50 contacts right now. Figure out, you're going to pick, like I said, maybe 20, 30, 25, 30 physicians who are the top, pretty much the high, the high usage. We're going to say that, that's the most, because that's the most thing, the high volume, usage of home health services. Go after those as your top end, right? The high utilization, as they may say, in your software. So go for high utilization, meaning that they have high referrals, and then also at the same time as they follow up with the patients. Then, maybe spend, your cardiology company, I bet you that they're a low utilized company, meaning that they have lots of home health patients. Now, a lot of patients that goes to home health, but they're not following up with it because they're having the PCP follow up, most of them, right?
Right.
So you have to have that bunch of mix. But once you have the information of the physicians, it allows you to really be more aggressive. Right? And like I said, don't forget, and like, hey doc, I just want to share some information about your company. I'm not sure if you're aware about, the type of patients that you have, and have a more idea of how, our services can help yours. And, this information is some amazing information that not everybody can get a hold of, but we got it through Medicare. And I think that it'll be valuable for you. And he's going to be like, well, what information? I'm like, yeah. And you start going with everything that talk about in Medicare Part B, because that's all the physician stuff is Medicare Part B, right? Home health is Medicare Part A. So Medicare Part, you can say, hey, I know, what type of the majority of your patients that has heart problems and CHF. These are good things to have information for you. So he's going to be like, well, he can't get those reports, but you can. And now you're going to share with them, but you're going to add that twist of like, hey, by the way, since I'm here, I know you're working with these 3 other agencies. Mm-hmm. And since I know you're working with these 3 other agencies, let's talk about this. And then what's nice about, remember you're talking about the care plan oversight, the CPOs, right?
Yes. We can get them to follow the patient.
How can you use telehealth for your CPOs?
I can for a care plan oversight.
How can you use telehealth to figure out how much the physician should have made last quarter or last year?
By seeing how many Medicare patients he has, and then by looking at the home health utilization, mm-hmm. and then seeing the diagnostic mix, the acuity levels.
Okay, you're taking it to the next level. Perfect. But here's the main thing, right? How much patients have home health is one, and the next is how much patients were followed up with home health. Because care plan oversights is for physicians that follow up patients at home.
Correct. Yes. So I can look where it says, go ahead, sorry.
Yeah, exactly. You can look.
Where it says patients followed.
I'll be like, hey, doc, do you know that last year that you could have billed a minimum of this much amount for all your like I know how much money, whatever, right? And I can even do this, right? This is the fun part, right? You know how many of his patients have received home health services. You know how many patients he only followed up. Let's say, for example, 100 patients needed home health services, but he only followed up 50 patients. So he did not follow up 50 other patients, right? So then I can say, hey, doc, do you know that you missed? So let's say a care plan oversight, there's the 3 different G codes. The first order for G codes, I think average is like $153 or something like that. So then I can say, hey, doc, you missed, let's make my life easy right now for math, okay? 100 patients has $153. Hey, doc, you missed 15,000 something, so-and-so last year. Did you know that?
Wow, yeah.
And like, what? Yeah, you lost $15,000. What are you talking about? Would you like me to stop by and explain it to you? Hell yes.
Oh my God, I'm so excited that you just said that. Because that's perfect. I love it.
That's how you use Trello. Be like, listen, the CPOs, doc, and doc, just to let you know, there's, because you can use the 3 different J codes. If the patient needs the first initial order, you can write that up, and then all the follow-up stuff that he can keep on reordering. Just to let you know, doc, we can get you these reports on a monthly basis or quarterly basis to make sure that your billing is done correctly and you're not missing any certain things. Mm-hmm. So, since like I said, we're going to go with 200 patients, 100 went yes, 100 went no. Just let you know, doctor, that's 200% of patients. This is how much you could be making additional each year. Is your biller actually billing these CPOs? Because just let you know, doc, a lot of physicians that I work with, the truth is this, doctor, is that they don't really deal with the coding. And sometimes things gets missed. And sometimes even staff. And so if you want, doc, I'll literally sit down with your staff and give you guys a little bit more quick 5-minute breakdown to make sure that you're not missing any money. Mm-hmm. We can't pay physicians, but we can teach them how to make more money.
I love that. So, question.
Sure.
I have a sort of reverse situation. Okay. So I'm going to a neurologist. So this is wonderful, especially for like the cardiologist, the neurologist have like 1,000 patients, sometimes that's like more than some hospitals, right? So like Medicare patients.
Yeah.
So I've been going to a neurology clinic and kind of sort of enticing them because I know that on Trella that neurologist does not follow very many patients, right? So originally I went and I told them about transitional care management. And then I found out that wasn't so appropriate for their office because they don't know when the patient gets discharged, so that would be kind of difficult to manage. Anywho, so the biller didn't even know that those codes existed. So she went back and I kept going, offering a little bit of information. And something she would ask questions, and I'd be like, oh my God, I don't know how to answer. Let me come back, and I'll get you some more information. So I would keep going. And I called to make an appointment, and she said that the doctor was very interested in that, and that they're very interested in it. But here's the part that I need to overcome the objection that he doesn't have any time. Because that takes time. So they're waiting to hire another provider. That's their objection. So this was in the very beginning when I first started watching your videos.
Hey Doc, listen, I truly understand that time is important for you, but at the very same time, if I can show you how to be able to make an extra $50,000 next year, would that make sense for you?
Mm-hmm.
I think $15,000 will make somebody, Doc, just let you know, time doesn't really matter. I just need 5 minutes of your time to kind of explain to you maybe certain things that you're missing. Would that be helpful for you if within 5 minutes that a light bulb will turn on automatically, Doc, and then you're going to say, crap, we missed 15,000? And just let you know, doctor, you can still back bill. If you missed, if these weren't done, you can still go back a little bit and do some back billing.
Oh, I didn't know you could do that. Okay, perfect. That's perfect. So then I can get the doctor to start ordering home health, and then they can back bill.
Not for the home health, but like, let's say, for example, he worked with patients with other agencies and they used home health.
Oh, okay.
And they were the primary physician, and you saw that maybe they're low utilization. Maybe they when you look at their report that the low utilization was maybe 100 patients or 50 patients or something like that, right? They saw 1,000, but they only followed through maybe 30, 40. That's them signing the papers. They can still backbill for those. It all depends on their biller and what the process is. Now, just to let you know, I don't know how far back they can backbill, but I know I've seen physicians do backbilling.
Okay.
That as long as it's legal. Once again, you're not here to tell them that you're doing it. Listen, this is what you can do. Physician, doctor, ask your biller. Maybe they can still go back in certain things and miss certain things, right? Because there's parts of those that can happen that you can backbill and stuff like that. It happens in home health, right? We do it all the time and stuff like that. So there's nothing really. What you're just sharing here is like, hey, let me share some information for you, doctor. And this is another thing that you can use for your low utilization physicians, is that they don't want to follow through because they think it's hard, or they don't want to follow through. So I'm like, do you know that if you follow through with this patient, that you can actually get this much money still? Right? And the best way to kind of start that question, like, hey, doctor, let me ask this question. If you can kind of just tell me, you guys have 1,000 patients that ended up needing home health services, and then out of those patients, you never saw any of those patients at home. Can you tell me what's the reason for that, or what's the procedure that you guys have? If they say, well, I don't like following through with those patients. That's perfectly fine, doctor. I just want to be able to know what's going on. Now, if it's a total 100% no follow-up, or like complete no utilization of home health, then maybe I'll say no to those. I won't go after them if it's like 1,000 and then 0, right? That means they just, they just don't do it. Now, if I'm seeing, let's say, 1,000 and they're seeing 50, well, that means they really don't say no. They still do it. So let me go back and find out what's going on, right? So if it's a total 0% utilization, don't go after them. If you're seeing that they are seeing some of them, then you're going to like, well, if you increase it, you're going to make additional money for the company, for the organizations. If you're the only physician, you're going to make more money for yourself. So then, that's where, money is such an incentive thing. Let me help you make more money for you to make sense. I mean, like, a good example is like when I go after private physicians, right, that are not really associated with the hospitals, that they're a private practice, I'm saying, hey, doc, $20,000 a year extra, is that going to be valuable for you, for your practice? And he's like, well, if he says yes, I'm like, well, great. Just let you know, I believe most, like, and then the number, like, for example, in Illinois, what we're seeing a lot there, for example, is like the physicians who are billing, right? So we did a quick survey one time, this is like about around 2015. What we did was we spoke to 20 physicians, and we did our own calculations. And those 20 physicians that we introduced a CPO to, right? We found out that in average, around 60, it was like, I think mid 60%, they were not billing it. So they were losing around more than 60% of billing. And so they're like, and so with those, what we did is when we helped them out, then all of a sudden, what? That's a 60% increase in profit for them that they were missing the previous year. And what I like to say, I'm like, does the 3 agencies that you're using right now, the top agencies, share with you this report on a monthly basis or a quarterly basis? And if they're like, no, which is, I'll tell you, you know, each agency, all the agencies love a CPO, care plan oversight. They have that. You guys have probably that flyer, knowing your company.
We sure do. We have like 3 different ones.
Yeah, everyone has that. But your company, I guarantee, didn't fully explain to you the strategy of it.
Not at all.
Here's a flyer, doctor, about CPO. No, doctor. It shouldn't be that way. You guys need to learn how it works. This flyer right here is important, and then know how to present it to the physician. So that's what I'm doing right now. We're talking about how to present it to the physician, how to use the software that you're using, Trella, how to use that software, how to really figure out that number. Because if I go, like I said, if you go in and you say, hey, doc, we literally you're missing this much. What? If me coming in for 5 minutes, I know that you're busy, and I can show you that there potentially you can earn this much money, or you can even go the next route. Instead of saying potentially that you can earn this much money, this is the best one. Is you say, doctor, do you know that there's a potential that you're losing $15,000 a year? Huh? So remember, like I told you, there's 2 different ways of saying it.
We continue on to the video. Just need to be able to take a few seconds of your time.
The video is brought to you by MedicationReminderProgram.com. Are you trying to look for that one edge up to be able to get you more referrals or to get new referral sources? Well, that's MedicationReminderProgram.com. If you start offering this for your patients and future patients, you're going to be able to show future referral sources that you're doing something different, that you're providing better services than your competition. The Daily Reminder Program goes like this. We will call the patients for you twice a day and remind them to take their medications at 9 o'clock in the morning and at 5 p.m. A top reason for hospitalization of seniors is not taking their medications. So what you're going to be doing here is you're going to be giving them comfort of mind, both family and referral sources. So sign up to MedicationReminderProgram.com right now. There's 3 packages available, but at the very same time, right now, with code 50 off, you can actually get 50% off our Gold plan and the Platinum plan. So just stop by MedicationReminderProgram.com and let us help you get more referrals. Let's go back to the video you're currently watching. You can get more money, but that's pleasure. Or if I say you might be losing $15,000, that's pain.
People react to that more.
Exactly. So when you go, like I said, when you look at your Trella, you're like, okay, this much. Let me do the quick calculation before I walk in, or maybe do the calculation already before the weekend of start writing all the calculation. That's why I said, grab all those physician informations, facility information, and straight up go in there and have the number. Hey, doc, and so you can even go to the part of, the flyer that they gave you guys for CPOs. I would write it in there. Potential loss of this much. And then, so imagine you explain that. They're going to listen. They're going to be like, what? And then, then you may use that for the physician to say, hey, this is the guy I want because we're losing money and I don't want to lose any more money. So then if the physician does tell them that they have no choice but to use you, now you're going to win on that. So that's what I would do on that. Like I said, pain and pleasure. 3 things that made you choose to work with agencies in the past. Then the second question is 3 things that would make that if they can improve on to provide better care for your patients and take care of you, what would that be? Negative. In a way, painful, but I'm not making it seem like I'm being a negative person.
Right.
So those are little push pulls that you can use. You guys have a company that provides a lot of information, a lot of teaching, educational based marketing materials for you guys, and they provide you with a software that is, I believe, that every single agency should have. and you guys should be lucky to know that the truth is most agencies don't. Last time I spoke to Trella, they said that they were servicing about 100 home health agencies. So knowing that, and 100 meaning that, your company is one of them, but you guys have multiple locations. So they count you as one company. They don't count you as every location you guys have all over the US. But that means you're just, potentially in your state, there's probably only a few other agencies using that software.
Right.
So, and then the question is, it goes to the part where just because the software is there, like when we first talked, you knew the software was there, but nobody really sat down with you and said, well, this is how I would use it in marketing.
Right.
Right? That's the thing right there. This is how I use strategy. Use it. Data is great information that could win you a lot of referrals, but when you know how to explain the data, right? That's where it becomes more, when you can translate it from data to application and sales and marketing, that makes you win. Just like what Trella did, there's so much information in Medicare Part A and B, they were able to put in a software that can make it easier for people to understand the information. Mm-hmm. So they're good at data. Now your job is to grab the data and go into the physicians with like strategies. And if you start doing that, when you have these meetings, so that's where the objection blocking is. Hey doc, look, I know you're busy, but looking at the numbers, at your numbers, doctor, it's showing here that I just want to make sure that potentially you're not losing $15,000 a year, $15,000 this quarter, $15,000, whatever it is. So if they start saying like, what? I just want to make sure. Now, right now from what I'm looking, doctor, so what you can do is 100 patients needing home health, 50 got referral, right? I will do the calculation of, doctor, you're missing somewhere. You potentially, if they're not doing CPOs correctly, you're going to calculate the 50 patients, right? And how much is that worth, right? And then you're going to go the higher route, the 100, right? So doctor, just let you know, you're missing between, let's say, $10,000 to about $20,000 of money lost. And then you can take it to the next level of saying this, hey doc, you're missing $10,000 to $20,000 potentially from wrongful billing that you're losing this quarter. So that means if we do that, times four quarters, this is how much you're losing, So, that's just ways of actually doing that, right? So, just give me a second, okay, Israel?
Sure.
Yeah, so that's just the thing, man. I mean, just use that stuff, and you'll be surprised what you can do, man. It's just that's the thing right there. But pay attention to the closing techniques. Pay attention to closing techniques, and then objection blockers. Once you start having those in your play, because like I said, that's what's gonna take you in your follow-ups, right? That doesn't take any less the fact that you need to learn how to present better, how to get at your presentation. When you are in your presentation, like I said, always start off with those 2 questions. It allows you to really pitch what you're going to be doing on your presentation portion. And once you have that, man, I mean, you're going to be good. So, I mean, what are 3-4 things that you want to, talk to me about that maybe I can address for you?
Okay, so my goal at this point, so they did talk to me, we had a little meeting, and I'm not gonna lie, so I was very, very nervous about it. Last week, especially, I was like, oh my, what have I done? This is a good company, what am I doing? And then I thought, and I was like, oh crap, well, I just gotta keep going no matter what. I can't think they're gonna fire me anyway. I can't think that way. I can't think, because a lot of the thing that was really holding me back now that I'm looking at it is all of that unfairness, that my contacts in other territories were were getting them. And finally, like, I just listening to your videos, I thought, oh wait, I can just do this again from the beginning. So I, like you told me, and like you're new to this. So that's literally every time I think that's not fair, or I say referral that comes from one of my contacts or somebody claimed, because there have been a lot. I think, oh, not fair that this rep just inherited an orthopedic. You know, I don't have any good, solid, high producing, consistently high producing accounts.
Yeah.
But then I think, oh, that's okay. You know, I'll just pretend like I'm brand new and I'll just do it all over again. And that's where your videos are, like, I like the cold calls, the presentation, and then I think, oh wait, I have Trella. And then I think if everything fails, for whatever reason, they do fire me, it's okay. I'll go to another home health agency and I'll do the exact same thing. So I think, okay, I don't, you know, so.
And the truth is, you know, the goal here is like really like once you know the whole thing, once you know the whole technique, you can go from one state to another, one agency to another, and just go at it. There's no sense in doing that. You know, I've even seen the part where like like a good friend of mine, you know, he produces around 100 referrals a month now, right? He's been, what's funny with him is he's been using my training as not even he doesn't even have access to the 10X. I gave him access to it for free and he doesn't use it. Like I literally said, I'm taking it away from you. You're not even using my stuff. But him and I would have, you know, 1 hour talks a week in the beginning and just like really just hit it. And now we just talk maybe like we talk about business, like maybe like about 1 hour a month now, but everything else just is like, hey, what's going on? But that's the same exact stuff, is that what's funny was he was with an agency, when he started there, he was bringing maybe 2 referrals a month his first 2 months. And then when he started working with me, he brought it up to about 20 a month. And what happened was the new DON that started working there was like, we don't need him. Why are we paying him extra money? We'll take care of his referral sources now and we'll just keep on getting it and I'll get you more, right? And they fired him while he was moving up. Now he went from 2 to 20 a month average. That's pretty good for most agencies, right? They're you know, and so, but the person, the company, the owner wanted to save $80,000, not pay him $80,000 because they thought that they can actually take care of that stuff. Well, all he had to do was go from one agency, went to the other, but now he had a real rapport with them, right? With the people, because he's the marketer, he's the one that dealt with them. And once you create the know, like, trust, once you're in the trust mode, they know you, they're just going to trust you wherever you go. Right? So he just literally went to every single one of them and said, hey, just let you guys know, I'm no longer working for so-and-so, you know, but please keep on referring to them if you want to. But also just let you know, I'm going to this company now and this is who I work for. It's a great company as well, right? What him and I, when we talked about it, is I said, listen, don't trash talk the company, but go in there and be like, tell them the truth and whatever. So what happened is he was able to take around 80% of his referral sources to his new agency, right? Goes to a new agency, and then he stayed from that agency and literally brought it. Then, of course, when he started, he was like maybe at around 10 referrals a month only again, you know, for the next 2 months. But he became aggressive, and from that moment on, when he started with a new company to now, it took him about 1.5 years with that company, and now he hit his first 3 straight month 100 people referrals. That's awesome. 3 straight months so far. So November last year, he was at 80. October, he was around 75, around there. And these are straight up Medicare clients. But he brings in Medicaid, he brings in private insurances as well, but he doesn't count it. But the company he works with, they can accept all those insurances and they still make some type of a profit. So, you know, that's my thing. It's like, it's not going to be like an overnight success, because it's going to take 8 weeks of follow-ups to maybe convert 20-30% of them into referral sources. But if you do 100 people on a market blitz, you do 100 people. If you can convert 20 to 30% of them, into a referral source in 8 weeks. Just imagine if you can get 10 per site. You can get your 20, you can get your 30 within that matter of 2 months. You can say you hit 15, 20, that's fine. But then you start a brand new marketing blitz again, right? You go for the next set of crop people. So pretty much what I always tell people is this: 100 people your first 2 months, go after them. You convert some of them, fine, okay? Then maybe 50% of those 100 becomes warm up enough that you should still keep on visiting them. So you transfer them the following month, in the following set of group, and you make them about 2 visits a month instead of 4 visits. Allows you to bring in another 50 new crop to the whole list that you're going to target for every week times a whole month. So that's the whole main goal. It's a slow process that you're going to need to be able, you're going to be able to process that, and that's how you increase. And so, I spoke to him today. I spoke to Ben today, and he literally has right now his what he calls A referral sources, his 8 groups. His A group, he has 10 A groups that gives him literally 80% of all his clients. So that means, if that's what he's telling me, 80 referrals come from 10 referral sources. Right? And the rest comes from his B group. Mm-hmm. So that's all you need. And how do you know that? High utilizations, you can see, yes. If you look at the high utilization, who are the top 3 agencies they're referring to, and if you see the numbers, like, oh, they're getting 50, they're getting 20, they're getting 30. If I jump in here and I become the top 3 choice, I might get, if the lowest one is 30, I might get 30 a month from this guy. I'm going for this guy. Because then but that's the thing, if you can get 20 who gives you 5 a month, 5 times 20,
yes,
it's 100.
That's because my mindset before I talked to you was, oh my, like, there's nothing, because the PCPs don't have that many patients. Medicare patients only have 67. But then I started thinking, when I was watching your videos, if you, 1 a month from each of them, 20 of them, it's a numbers thing, right? Of course, you still have to do good at your presentation and all that stuff and close. But that it's working, like the stuff that you're telling me in your videos and right now. Anyway, so, and then planning your territory, the location, if you're next to an office that's high producing, and then there's another one that's not, you're already there, might as well go, right? To the one that's, even though that's a little bit, they don't have any patients, you're already there. That could be your 1 a month. So I've been looking through Trella, and then there's accounts where I thought there wasn't that much potential, and then I calculated, how many they actually sent a year. And then I saw, oh wait, those are Medicare 5 a month. What am I doing? So I went back, and now that's what I've been doing, just hitting up doctors' offices, and hospitals. The hospitals are what's up?
Like I said, you'll be surprised if sometimes, and that's the funny part. I mean, look, with the Trella Health stuff, you're like, I don't want to go after the smaller, the ones with small amount of patients to give, right? Mm-hmm. And I'm like, if somebody else was using Trella, for example, and looking at the same data, right? And they're like, well, why do I waste for the one that's only giving 2 patients a month, right? So once again, you're just getting potential because that's one lost competition that's not going to go there. Mm-hmm. Right? Because then it also helps. That's where you hear physicians say, well, we don't really have that much patients to give out, to refer. But because maybe the physicians are saying, we only have 10 patients to give. But he doesn't know, is like, well, fine, doc, I'll take the 10 patients. That's my mind. I'll take the 10 patients. That's not enough? Okay, great. Well, I'll take the 10 patients, doc. Who cares? Imagine if you have 50 giving you 2 a month only. That's still 100.
That's right.
So most I know the average, what we're seeing a lot is a lot of agencies are paying around $70,000 to $80,000 for somebody that can bring in 15 patients a month. That's what we're seeing is the average referral source, average payments for marketers.
Wait, like including bonus?
Typically that's, because everyone's different. So yeah, we'll just say including bonus or not including bonus. 15 patients a month, you're looking about between $65,000 to $80,000 a year, right?
Mm-hmm.
So, so I'm going to give you an example. Just imagine my friend who's bringing in 100.
Yeah.
It's so bad. This is the funny part. He's so good now that the owner is now thinking of giving him partnership in the company, because he knows if this guy goes, that's 100 patients going to lose.
See, I also like that. Like in your videos, you say, be so good that they can't get rid of you.
Yeah.
And so
be the one that's indispensable. But at the same time, you don't want to, once you reach a certain level, you don't want to be a dick about it.
And that was me. When I was doing so good. I'm looking back now, like 5 years ago, I'm like, what was I thinking? That was me.
There's nothing wrong with it. I'll sort of kind of be the person, but not be it. Meaning that, like I can humble brag. I know who I am. I can deliver. Like, I'll speak for my stuff. But you don't have, we don't have to worry about that. Fine. And so, once you have your results, that's going to speak for you enough. It's just what's going to speak for you as a person, as a resource and stuff like that. One thing I do tell, this is the funny part, is that, because I would, just for the fun of it, some agencies that don't know who I am, I'll start working. Every now and then I'll work every quarter for a new agency.
Okay.
Right now, I'm working for another agency right now. They don't know, but what's funny, I work for one agency until all of a sudden one of the marketers recognized me. And the marketer's like, I've seen your videos, but by this time I was already about to quit. So, because I brought, I came in, new area. I would drive 50 miles just to go to their area, because I don't like to work around where I live. And so I drove 50 miles every day for like a month and a half. And I went from 0 to averaging about 50 within less than 2 months. Right. And then I literally said, okay, I'm quitting. They're like, why are you quitting? And I'm like, they're like, are you, it was funny they're like, why are you quitting? I'm like, are you going to another company? This and that. And I'm like, no, I'm just literally quitting. Why do you want to quit? We're giving you bonuses. And it's funny. They're like, we'll double your bonus. How about that? We'll blah, blah, this and that. I'm like, no, I'm good. But we just hired 5 more nurses to cover your referrals.
Mm-hmm.
Well, I quit. I'm quitting. I'm giving you my 2 weeks. So I still practice in the field, because I want to say, okay, what's working, what's not working? Do I have a new idea? Like the Trella Health stuff, those type of information, I've only been using those for maybe the past 3 years. I just met Trella Health this year, but there was another company that we were using, another company that had the same information, right? But that's the one that I was using for my agencies. And Trella Health, what I like about Trella Health is that they're the most recent quarter. The company I was working with only had information last year. So I was still able to use that, because once again, last year, this is how much you lost, doctor.
That's like such a great tool, because my sister's a pharmaceutical rep, and she already gets like the reports, like how, like the physicians, who they're writing, like what prescriptions they're writing and all that. Of course, it's on a weekly basis. But like not having that, now that I have Trella and I'm actually using it, I'm thinking, oh my, there's so much opportunity, because you get to know. And I've told like some of my old referral sources that are no longer in my territory, I'm like, look, thank you for being so loyal to me. I can see that you wrote for Forte Health Services, a company that I used to work with. Isn't this neat? And they're like, yes, it's amazing. I love it.
I mean, you have a good software, you have all the stuff, you have your, use it. Use it the right way, take advantage of every little thing. When your company they probably gave you a little training about Trella, how to use it, how to access it and stuff like that, but they never really gave you guys the training on how to be able to use it the right way.
Correct. That's the missing.
They're trying to give you guys your own way to figure it out your own, and this is what it's used for. And I appreciate companies like those, but the thing though is, in my end, in my team and people that I work with, it's like, don't just tell me I have, it's like, it's not, most of these things are not like iPhones, right? Heck, like I'm using an Android and I have an iPhone, right? I hate my Android. I don't know why I purchased it, right? But I have to use it. It's there. But it's not, Trella or marketing is not an iPhone where you can open it and you never used an iPhone before and you're gonna figure it out. It's user friendly, right? Same thing with Trella. Trella is literally, I call Trella the Android of softwares, of anything that you can use. You still have to kind of, there's a learning curve. But if you know how to use it and take advantage of it, then now you can kind of process the whole thing. And so now you have the tools, man, just use it. And then, that's the fun part is each one of your educational-based marketing materials that you have, there's a different way to present each one of them. I just gave you the ways of how to do the CPOs, right? They gave you the educational-based marketing material, but they didn't tell you how to present it the right way and push it, right? So that's that. And so if you have your diabetes program, how to present that. But remember now, so you guys have an education-based marketing material for diabetes, right?
We do. We have one. So we have one sales slick for that. And then for our cardiopulmonary or more popular programs, we have several different types, like tiny cards, and we have big sales slicks and trifold brochures. And I know that I've stopped using those ever since I've been watching your videos, even the specialty program ones, because you're right, who's going to open a trifold brochure? Yeah, but yes, to answer your question, yes.
You have all these, right? So then how do you use telehealth for those?
I look at it. So I actually did this yesterday when I talked to a physician who has a lot of cardiac patients. He's a primary care. And I looked at the new MarketScape is really awesome. So I looked at the acuity level and I compared the agencies and I saw how we were doing compared to other agencies. Sometimes we don't have enough patients for us to compare. So there's no information. So then I get the other agencies and I compare them side by side, just like in a report, right? So anywho, I saw that most of our patients are cardiac patients. So I prepared the national outcomes sales slide. I don't have it here, but and then I had that prepared if he was open for me to present it once asking him about what do you look for in a home health agency. And like the probing, I didn't say that the three things. What three things? But every time after a sales call, I think, oh, I could have done this. I could have done this. Oops, I said please. Oops. The next time I'm not going to do it.
So what you're doing right now, right? Just pay attention. What you're doing now, you're analyzing yourself. So what's nice is that when you start once you start doing this in a while, you're gonna walk out. You're like, crap, I forgot to do this. I forgot this close. I messed up on this. Once you can start analyzing yourself, you're starting to move to the direction that you're doing good. The reason for that is, inexperienced marketers will go out and be like, oh, I did a good job. They said, what happens is they're patting their backs, right? The doctor says, oh, it's a great presentation. Next time that we have a patient, we're going to refer to you. They walk out, they're like, oh, you're such a good person, Michael. You pat your back. They did good. Every time I go out, even though I know I crushed a presentation, I crushed a walk-in, I'm telling myself, like, what did I do wrong? What did I miss? Maybe I could have added something. How could I have improved it? And I go to my CRM and I start writing down, like, I forgot to do this. I forgot to do that. I forgot to do this. Add this. Why? Next time I visit, I'm going to be like, hey, by the way, I forgot to talk to you about this. And next time so that's why I use my CRM softwares, because I'm like, just wanted to follow up. It also gives me a reason to make a quick phone call or a quick email. So remember how you're trying to get a hold of that one person and you're just text messaging when you sent me that text message? What I would do, grab my phone, make a quick video and say, hey, instead of sending them a text message, send them a video message. Like, hey, I was here having some coffee right now. And this is one of my favorite routines, right? My favorite routine is, hey, this Michael, just having some coffee right now. And just want to talk to you about, I know you're busy and that, you give me a call whenever. But anyways, listen, I just want to say thank you so much for responding to me. I really, really appreciate it. Just want to say it's a happy Friday or happy Wednesday, happy whatever. I'm having a cup of coffee here. Since I'm at Starbucks, how about I buy you your next drink? When you're available, you tell me, I'll buy it from Starbucks. I'll bring it to you. And we'll have a quick 30-second chat. That's all I want. So you're just like, now I'm like trying to get that interest. Like, oh, they say, because what happens is I sent them a video. No other marketer ever sent a video. The fact that you have their cell phone and you get to text message them, you're one step up. Now it's just like, what can I do to make it different? Right? So I would send something like that.
I like that. And even if they're I was coming up with internal objections, and I thought, no, I'm still gonna do it. I thought, oh, but they're not allowed to accept drinks. I'm like, who cares? I'm just gonna do it, and they might say, you never know, right?
Yeah.
So
you're not able to accept drinks, and then if that's the case, is that in the policy procedure they can't accept drinks?
Yes, that's what they say that, like in one hospital they say they can't accept things, but when I give them off, when I started handing off the little treats, they still take them. Like they're still hungry. They still are super busy. Actually, somebody said, "Hey, how did you know that I needed this?" I said, "Because I work with busy people. I get it."
Yeah.
So yeah.
And those are the main things. And what I like to do is like, for example, like I'll go to. Do you guys have a Sam's Club in your area?
We do. We have Costco. We have Costco.
I'm not cool enough to have a Costco. So, anyways, where's the Costco? But I'm not cool enough to go to Costco. So I'm like, I still haven't got rid of my Sam's card. So in Sam's Club, I'll go in there and they have they have boxes of those natural grains granolas, the Quaker's oatmeals. You get the 50-pack. Love it. That's what I'm talking about. You got gummies in there?
Huh?
You got gummies in there, right?
I made these labels because they don't actually, a big company like Kindred doesn't provide us with labels, so I got a bunch of Avery labels and then I just made them myself.
You know what's my favorite Avery label?
Which one?
Avery label. It's the brown ones, the brown colored ones.
Oh, I have some of those actually.
Those I love those just because it looks kind of cool. It's like more of like I don't know. That's what I use. But I love Avery labels, and so same thing. Put that in there, and like I'll give you an example. My one of my favorite. I haven't done this in a while. Like I used my last one about 2 years ago because like I said, it's just I don't use it for my company. But when I do market, I used to have these lollipops.
The cards
with my face in it.
I want those.
Yeah,
I want to order those. Yeah.
Did my video about it where I had the picture of it?
Yes, and then yes, I looked at it and then I tried looking for it online and I couldn't find it, but I'm gonna go back because I really want those.
Yeah,
I
got that idea from Oprah.
Oh, that's cool.
Yeah, that's where I got it from. Oprah was like, this is, she's like, these are. It was an Oprah magazine. These are one of my favorite things of the year. And she had those made with her face in it. I mean, not her face, but her face, and then Harpo Studios and stuff like that. And I found the same company that she was using. Turns out to be they were where I had my office in Clarendon Hills before, and I was like, I went there and they made it from scratch, and it cost me like $1.25. No, it was $1.50. Then I ordered more, and it became $1.25. So it's up to you if you want to do those things. I'm not saying you should, but you just have to change things up that makes people like say like, oh, crap, I never seen that before done.
Like the video, I'm gonna do it anyway. I don't care, because they've never seen that. Even if they say no thanks, then who cares?
Video. And so what we try to say is like, I tell my marketers, that works in my agencies, I'm like, listen, I want you to send a video message every week. Like a video message every week. And so if you have their email, if you have their text message, it's like, listen, I want you to make it. So when my guys make emails, like if they're going to write an email this week, that's not in our email. Cause like I said, we do our mailing boss where there's already a guaranteed email that gets sent to them. But if it becomes a more personal email, so let's say, for example, this week is, let's say Valentine's Day just happened, right? So, if it's Valentine's Day week, right? So we're going to be like, hey, you know what? Just want to say have a happy Valentine's Day, so-and-so, blah, blah, and do a greeting. Attach that video, that short video in your email, right? And then it becomes like you write the email and there's a video attached. So there's just different things of doing it because it's not about, is that going to get me my referral? It's, is it going to make me stand out?
Omnipresent.
Mm-hmm. Is it going to make me memorable? Is it going to be like, like like what's funny is like I've done it. I've actually sat in front of other marketers, and some marketers will be like, I'm like, if you're going to pick me over him or her because of our looks, I lost. Right? I'm not going to be the best dressed person. Italian cuts did not fit me well. I'm, fine. But it's not about the looks. It's about when I go in, can I give value? Can I present myself better? Can I make sense? Can I make the person, gain the person's trust? I know I'll beat you there. But at the very same time, you're going to see sometimes where you're going to walk in a referral source and your competition is in the waiting room as well with you.
Yes.
Right?
And that used to bug me, and now it doesn't.
So what I always do, so when you're doing the sit down, when you're having a sit down moment, right? Benji, my friend, like I told you earlier, the 100 a month producer, he does it now all the time and he enjoys it. Like he will pretty much put ice in their feet and literally say, hey, and he'll just introduce them, hey, Benji. It's Benji with his company. And your marketer here? And they say, yes. I'm like, oh, with company. And he'll start talking to them. Oh, perfect. That's great. Especially if it's the part where the person already that you're going to be meeting, and they call you like, hey, John, what's going on? And you just go with a happy smile. Then the guy is like, oh, crap, he knows him. Because the reason why that works is like, I'm just going to, you want to burn everybody down. I mean, I'm going to, like I said, I'm not an aggressive person and I'm not going to put people down. I'm not going to be I hate to say the word dick about it, but I'm going to do it in a different way and seriously going to be like, listen, this is my territory, like, hey, how can I help you? Hey, but at the same time that's the best way to get somebody rather than having to stare down a sitting, like, you're both there. No, yeah. I'm going to be whatever. And another thing, if I know you're a marketer for home health and we're in the room together, right? Then you can do different things. You don't have to approach and introduce yourself. You have to do what they call power poses, right? So you sit down, cross your legs, put your hands up, be like, I'm ease. Make him be like, crap. It's like the same thing when you're in a boxing match. Sometimes the guy is still standing in his corner when he should be sitting down, but he's standing to make the person seems like he's not tired. So there's a lot of psychology to this whole thing.
And that's what I love about your videos. As I was driving after you had asked me to do this video with you, I thought one of the big things that has really helped is the psychology part. Mm-hmm. So now I know if I'm like slumping over, or if like I think they're gonna ask a question that I can't answer, I like catch myself and I think, oh wait, no, okay, So then I smile, and I want to pick up the phone. I smile no matter what, and it's been working out for appointments and for getting orders, for bothering them because the order wasn't written right. They put me through the line. So thank you.
You're welcome. I mean, like, and the truth is that it's like our sales team, when we make phone calls, we actually got them what we call VoIP systems. And so what we kind of do is that we can literally record their calls. So all my sales teams, when they're making their cold calls, it's being recorded. The audio is being recorded. That's so we can actually go back and listen to it. So I can be like,
is this being recorded, by the way? Because it would be cool if it was, because I'm not going to remember everything.
Like I said, I'm recording it. So it's part of the podcasting that I'm doing. So
sweet. Okay, cool.
I'll get you a copy of it as well.
Thank you.
What it is that it's literally, if you can record yourself. So like you say, you're looking at yourself, making sure you smile. So before all these wonderful technology that we have now, right? I mean, and that's the thing. It's like, it's so better for marketers nowadays because you guys have so many tools. I didn't have Instagram. I didn't have Facebook. I was like, I'm not joining Facebook. This was like when Facebook came out. I was like, I'm not joining Facebook. That's for high school, college kids. I'm an old person, right? I'm 30. I'm not doing Facebook. What are you talking about? I just joined Facebook, 6 years ago? So, so it's like you have so many tools in front of you guys that's like so amazing. But that's the stuff is that before, my team would have a mirror in their desk space. Mm-hmm. There'll be a mirror in front of them so that when they're talking to somebody, they have to look in the mirror. we put a mirror in. Then you know, my sales officer around that time, he just wrote in a Sharpie, says, "Look at me when you're calling." So, you know, we just did that. So you're looking in the mirror, you're like, okay, so how you look in the mirror is how you're transferring the way you're talking, you know? And so just it's funny how like just sitting up straight when you're calling changes the tone of your voice.
It sure does.
Right. And so it's just a matter of how do I transfer. So like, yeah, cold calling, but mine's, like you said, I'm glad you picked it up. Mindset it is. It's all it is mindset, because if your mind is not right on the certain situation that you're in, what ends up happening is you can't really deliver it correctly. And then if you don't have the right term, the right words, the right way to do things, the strategies, as we say, like there's what they call the strategies and there's the tactics. Tactics is the CPO, the sheet that you have. Strategy is how to use the tactics correctly, right? And how to deliver it. So that's where mindset happens. You know, you have to have the right part. You know, I love the fact that you told me in the beginning of this stuff, you started like, I was bold. I went straight for 12:30, you know? And I'm like, and that right there shows me that that's a good sign for you, because you're like, I'm willing to go for 12:30. Whereas you ask, well, what time works for you? And so when it's in that process of thinking, like, what time works for you? That's us being, you know, please just give me a time, right? But, you know, if you're like 12:30, if they say no, then you can regroup and say, that's perfectly fine. 12:30 could be busy for you. And how about this, and that? You know,
yeah.
So it's all about mindset. And, you know, when I first got into really sales and marketing for home health, it was just like, you know, please give me a referral, please.
Yep.
It was just like, I'm here. And it's funny, like around that, because my parents was the one that got me into the industry. So what they were taught was that by previous marketers that was getting money is like, give them food. So here I am, like, hey, I brought you pancit, or hey, I brought you this, or hey, I brought you that. You know, and it was never, you know, when you cannot analyze the reason why you made a mistake is when you lose. So earlier you said, like, when you got out of a presentation, you're like, oh, I could have done this, I missed this, maybe I should have said this. That means you're now analyzing yourself. And most people don't even want to do what they call constructive criticism. They can't take it themselves, but they can't even give it to themselves. So once you start having that mindset that you can actually start telling yourself, I made a mistake, I forgot this, I did that, that right there shows that you're in the right path of improvement. You know, so that's it. It's just like, go straight up crazy. You have the CEOs, you have Trella Health, just go in there and just like hit them. So like, so I know you talked about that. What other things can I kind of address for you that maybe you can make?
And there's so many things that I probably can't think of right now. And I'm honestly so excited to just talk about like my experience, how much of a difference it's made. Actually, my manager, when they had the talk with me, they did say, you know, I did notice that for the past week and a half, there has been a change. Like, they've noticed something is going on, even though the numbers they haven't been converted yet. They're like, you know, I did notice an improvement, you know, keep that up, you know? So when we were having our meetings, and that was the time when I started watching the videos, when I talked to you. And
awesome.
So, I mean, it makes a difference just how I carry myself now.
And so I'm going to ask this question right now. Those 3 referrals you got, did you get it from the same place?
So I got 2 from the same place, and it was my second call.
Okay.
There. Actually, I'm sorry. It was my second call. So the first call, I did what you told. Okay, I did the whole. I'm in the sales process with that sniff. Now that I'm thinking about it, because I called to make an appointment, and they said that so the lady said, call me back on Monday, and I was just starting to watch your videos, right? So then I did call back on Monday, and I kept it short, you know, want to know, I just want to see how I can help you and your patients. I don't actually remember, but anyway, it got it done. I watched your videos and I did what you told me to do. So, so then we set up the appointment for Wednesday at 10, and I went in there, met them for the first time, super busy, and I employed what you're telling me, I understand you're busy, that's why I'm here, type thing. And I listened to what their needs were. They said, we have a lot of HMOs here. WellMed, that's a big plan here in Texas. It's a very restrictive HMO, so we don't take that.
Got it.
But then she said, but you know what? I have a couple Medicare. And then I thought, okay, well, there's a couple Medicare. I'm still going to come. There's still potential here. And then she said, after we had our meeting, and I presented just a little bit of information about one of our programs that on the flyer it says 10.2% readmission rate for high acuity patients or whatever. It was super quick because she was super busy. So she said, come back on Monday. That's when I have my discharge list. And I said, okay, well, I will. So I went back yesterday, and she said, okay, what are you doing here? I'm like, well, you told me to come back because you told me you were going to have your discharge list. Oh, yeah. So she went to her computer. She said, I do have a couple Medicare. And she went through them, and she just gave me the names, and she said, go send them to your company, verify that everything's okay, and I'll give you the referral packet. And I was like, wow, this stuff really works. Like, the sales process, the shortening of the sales cycle series. Yeah. That's exactly what I went for that, how you were saying, because I need to at this point with Kindred, right? So it's like, okay, I need to make new calls, and it's possible to shorten the sales cycle, even though it's very rare to get your first referral, but it's happened to me though. But the first referral, the first call, you can still shorten it, and then now the important thing is for me to follow through, give her a thank you card, because I haven't done that. I went today and to follow up again. She wasn't answering my text messages, and I was like, hey, when do you want me to go and actually talk with the patient and follow up? She wasn't answering, so I just showed up like you told me to do, just go. And again, she was like, I'm super busy, I'm so sorry. I was like, no, I'm here to follow up on those 2 patients. She said, oh, I'm so sorry, I know you texted me, but I'm so busy. And again, I'm like, okay, yes, I know, here's some snacks. So basically with that account is the perfect example of following the sales cycle. And I haven't yet completed the sales oxygenation / cycle because I'm still in the actually, following up part. Okay,
but so the fact, so you have to understand now, you're closed. You close that deal. You're getting referrals. So you have to now once you close the deal, they're referring. Now they go into your, remember, like I said, you target the 100 or 100, let's say you target 50. And then once you convert them, they're no longer in a follow-up system for you. They're no longer in a sales process for you. They go into your follow-up movement now. So now it's like walking in, be like, walking in, be like, hey, just wanted to drop by and brought you some snacks. What? Yeah, just some snacks. And by the way, just let me know if you need anything. If you have any patients or family members that you want me to follow up, we'll take care of that for you. But here's some snacks for you. I know you're busy, gotta go. I'll stop by another time, bring you some more snacks, okay? And walk away. Like, thank you. And that's all. 5 minutes. Walk in and out. And they're like, what? They didn't ask anything from you.
Right.
Right?
Right.
When you walk out, end of the day, send them a text message, be like, hey, hope the snacks helped. If it haven't, I hope you kept it and make sure you eat it tomorrow or enjoy it. Let me know if there's anything you like. I want to be able to help you out. So, yes. So what happens is they start getting shocked and they're like, wait, what? I don't understand. They get confused because you're not being pushy, Right. So then the next visit comes in and you're like, hey, since I'm here, are there any patients that you need help with? I know Mondays is when you guys need, because the truth is when they get that discharge list, discharge begins the moment the patient's admitted. So,
right.
So when they say, I'm going to get the list on Monday, the truth is not really there. They already know kind of, because there's already the meetings that's happened, all that stuff, the therapy meetings, the DON assessments, the management assessments, they have those Monday morning meetings kind of. I get it that she gets it in every Mondays. So what I would do is, so pay attention. That means her list comes in every Monday. So what I would do for that is, now that you know that that's what it is for her, I would do something like visit on a Monday and just drop off some snacks. Be like, hey, just figured, here's, the kind of drinks I always have in my goodie bag in my car is I always have a cooler, right? I have a cooler and I just fill it up with, orange juice, cranberry juice, the ones that are sealables and stuff like that. Put it in there, put ice in there, so that when I go in, I'm like, hey, brought you some orange juice. Cold.
Actually, that's a wonderful idea.
Hey, brought you some stuff, this and that. Great, So that's just one thing that you can do, is like you can walk in and be like, hey, got you this. I've even done it where I still have. It's funny, I still have it here because I just used it actually like 2 months ago. I bought one of those coffee thermoses, the real big ones, right? And what I would do is I actually have in my office, my previous office, we actually had one of those what do you call it, for hospitality coffee makers, where it can make like literally like about 30 pots of coffee.
Yes, I'm gonna get one of those.
So we used to make 30 pots of coffee nonstop, and we'll fill those up. And then we go out marketing, we have coffee that we don't run out in. And so what I would do is like once a week, what we would either send somebody to do coffee runs. His whole job every day, like I have for example, he still, John still does the coffee run right now. So what happens is every week it's every 2 weeks now. I change it up a little bit. Yeah, we changed it up because it was winter time. Winter, we go once a week because we don't want them driving too much. But they should be starting once a week now. So what happens is they go, we bought one, like if you go to Dunkin' Donuts or Starbucks, you can buy those big the box of Joes. Right?
Yes.
We don't buy those because it's expensive at Starbucks and Dunkin' Donuts. So what we did is we purchased our own that we can actually put our logo on it, and then we fill it up ourselves and we deliver it. So that's how we kind of, so it's like self-branding coffee and stuff like that. So there's just so many different ways that you guys can do it. We have our own coffee mugs, like the Starbucks containers. Ours have our logos on it. We bought sleeves, and in the sleeves we just put our logos on it. And that's why, remember I told you about, I like the brown colored stickers.
Oh, because it goes with the sleeve.
Because it goes with the sleeves. And so when we stick on the sleeve, it looks like it's part of the whole logo system.
I like
so when
that.
we get coffee, when we start dropping off coffee, that kind of gives the coffee routines and stuff. So there's just different ways, just walk in and be like, here's just brought you some snack, brought you an orange juice, kind of figured it's early in the morning, should probably help you guys out. I know Mondays is, is there any patients that you need help with? Right? I'm not going to say, I know your list is on a Monday. I'm walking in and be like, hey, since I'm here, just dropping this off. Is there anything that I can do for you?
Mm-hmm.
It's something like, well, we don't have any patients right now, but I'm going to find out the list later on. Hey, perfect. Can I follow up with you later on then? Sure. Perfect. Okay. We follow up with them. So and then those are things, once again, goes into your CRM. Be like, I know I need to visit this person every Monday because the list is there. The list is there. Let me visit this person. And nowadays, if you don't have a CRM system, just use Siri, right? Or, I don't know who was in Android, but that's the thing. It's like, hey, Siri, remind me every Monday that this is the place I'm visiting.
Mm-hmm.
So once you start having those things, man, you'd be surprised. Once again, when you realize it, follow up. Talk about the shorten the sales cycle. How do we shorten the sales cycle? By visiting them once a week times 8 weeks, calling them and emailing them the right things. Why is that shortening? Because most people will visit them once, 6 months, or never. We're just bunching them in with the right type of follow-up. If later on you start creating an email sequence, then it's even better. Once you improve on this, then we can stack more stuff with you. Like our mailing system, the mailing company, the email system that we use for mailing actually has a script generator already. Right? So I'll send you a link. To it actually. It has a script generator, so it already tells you how to email. Like it's gonna say, what are you trying to sell, right? And then so you kind of go through what type of email you want. Do you want a sales email? Do you want follow-up emails? And then it tells you, okay, what are the 3 things you want to talk about? What's the this? And so you just type in what you want in there, and it automatically creates the email for you.
That's neat and grammatically correct and everything. That's awesome.
So that's like, even you can use it now if you want to. Because there's just a variety of different ways of doing stuff. It's just the craziest thing. Like nowadays, it's like, you know, now mind you, maybe I'm one of those more of like sadistic people that I like the pain of failing and learning how to fix things, you know, because I won't be where I'm at right now. But that's the fun part. It's like nowadays, it's like there's so many solutions for you guys that you guys have. You know, like I said, Siri is freaking crazy for me, because with Siri and stuff like that, I can be like, hey Siri, remind me in 30 minutes to call so and so. Hey Siri, you know, I'm driving around. Hey Siri, remind me, oh yeah, you can use Google and Android. Hey Google, there you go. So I'm like, hey Siri, do this for me. Hey Siri, remind me to do this. Hey Siri, remind. And so when I'm driving, all of a sudden Siri reminds me, say, hey, you need to call this person. All right, great. Let me do that. You know, and so it's like, you know, you don't have to write things down. Just whatever you're using, let it remind you. You know, like for example, you know, I can't wait to buy the next car that has Alexa in it, because I use Alexa more at home than anything. So it's just, man, you guys just, once you know the process, just follow through. You'd be surprised. You got 3 from this, just from the basic follow-up. Imagine if you're going to 50 new places and targeting those people. Just imagine if you just get those 10 places that gives you, once again, 10 places that gives you 3 a month.
Mm-hmm.
That's 30.
Yes.
But what if all of a sudden those 10 places are giving you 6 a month? That's 60. And most in your facility, in your agency, their minimum is what? 15, 20 a month? 20 a month just to meet your base, your stuff. That's the funny part. 20 is easy in 3 months to get. In 3 months time, 20, you can do 20 in a matter of a month, 2 months, if you do the follow-up system. Because all you need to get 20 is what? 10 to give you 2 a month, 5 to give you 4. You know, that's all you need. So the follow-up system, just by numbers, with the knowledge, with being bold and stuff like that, you'd be surprised, dude. You'd be surprised what you can create, man. I mean, you know, the fact you got 3 right away, that's way better than the average people out there.
Thank you. That's why I'm excited about, I'm thinking, this is possible. You know, I can do it again. You can build it up again. Just think like I'm new. You know, just don't even think about the other stuff, how people have, whatever, screwed me over. I don't care anymore. You know, I'm just going to focus on this. And you, like you were telling me that you had someone who went from working from Starbucks to making a 6-figure salary, right? So I thought, oh wait, I can do that. And it's even better for me because I've already done it. So just take the good things from the past. Don't think about the bad stuff or the things that make me like anxious or angry, and then just watch your videos. There's a process to it. You can shorten it. It's worked already. Just showing up works. Just showing up to the clinic where they don't even let me get past, you know, coming up with different solutions. I mean, that got me like a Medicare referral, and that was 1 week. Just showing up several times, you know, asking for that order for that patient, and because they're too busy and they're going to get to it tomorrow, and then they don't get to it. Oh, well, I'm going to call every single day. I'm going to show up if I don't get a hold of that person, and I'm going to thank them. Basically, everything that you say in your videos, I remember throughout the day, and I think, oh yeah, like I'm going to do that. That's the solution. If I mess up in a presentation, I used to think, oh no, everything's ruined. They're not going to send business to me. And then I think about your videos, like your other parts of the sales process, the objection blocking. You know, you may have messed up, not have the best presentation, but I think, okay, I can recover, you know, by doing the objection blocking, bringing it up the next time I go. So before I used to be such a perfectionist, and I still am. I still have some tendencies, and then I think, wait, it's no big deal. Everything, you can figure everything out. It's not,
Exactly.
you know what I mean? So
exactly. And if you probably see in my videos when I have those live video recordings that I have, if sometimes it's but even with the ones where it's PowerPoint presentation style, you'll hear me cough. You'll hear me like say it's not edited. I don't edit any of my presentations. And the reason for that is because, you know, once again, I believe in the part that people are going to mess up. I would rather people see me cough or see me mess up or see me stutter so they know that I'm a true person. I'm not trying to perfect things. The problem is when somebody messes up and then you had to freeze and you're like, because now you're overthinking. Now, when you know that you're going to mess up, that's another thing I want you to understand is you're going to mess up. You're going to mess up somewhere, somehow. So when you do mess up, I'm going to mess up anyways. I'm like, okay, keep on going. Whereas people were like, when they mess up on a presentation, they're like, they pause. And then when you pause and you start to be like, you try to recover, when you're actually really trying to recover, they will see you try to recover and they're like, maybe this person doesn't really know about their services as much. Whereas if you don't pay attention to it, you mess up and stuff like that, and you just stack on and add on and keep on adding more stuff, because I always they may not have even seen it, And so that's just where you have to have. You're going to mess up. It's perfectly fine. But more likely, they won't remember it.
Yes, I love that people, I've noticed that too. Oh my gosh, I have this story to tell you. There's this one particular case manager, and I asked her out to lunch, right? Oh, I think I told you about this. I did tell you the first time that we met, I think. So she was so angry and paranoid. I don't know if something happened before that she got in trouble, but she totally freaked out on me and called the head of case management and called me back and said I was taken aback. And I was like, in my mind, I'm like, I just asked you out for lunch. Like that's all I did. So she was so angry, and she said, I reported you next time you.
Before we continue on to the video, just need to be able to take a few seconds of your time. This video is brought to you by one of our sponsors, HomeCareAnsweringService.com. So our job here at HomeCareAnsweringService.com is to be able to make sure that you stop missing any calls, because we're going to handle the calls for you 24 hours a day, 7 days a week, 365 days of the year, even during the holidays. So mostly we're going to be doing a lot of your after-hour calls to be able to give you some time to be able to rest rather than staying up or waking up in the middle of the night to answer any phone calls coming in for your home care, your hospice, or your home health agency. It's also going to be able to help you guys reduce the cost. Instead of hiring a full-time receptionist, especially if you are in the beginning process of starting your business, you want to be able to reduce your costs at this very moment. We are HIPAA compliant. Also, when we want to contact you, we can send you messages via text message, via email, or even via leaving a voicemail in your current phone. Another thing is we are just one price service, right? We don't charge anything different for our after hours on our morning hour calls. Also, remember, we are industry specific. We only work with home health, with home care, and hospice agencies. Also, it's a month-to-month program. We don't have any yearly or 2-year contracts. So you just pretty much pay as you go. Now, we have 3 different plans. Typically, most of the people will sign up with our silver plan, which includes 100 minutes a month, which is $99 a month. And any additional minutes after that is just 95 cents. If you are starting your agency, you can start off with the basic plan, which is $39 a month, and you get an instant 20 minutes per month available for you. This is really good if you're just starting off your agency and you're still working a full-time job and you don't want to miss any phone calls. So sign up at this very moment to HomeCareAnsweringService.com and stop missing those calls.
You come up and you don't have a patient, I'm going to call your CEO and all this stuff. And then I was thinking, oh my God, I can't see her. When I go to that hospital, I can't see her. Well, I did. I have a few times. And it seems like she just totally forgot about that. And I think, oh, that's right. People don't remember everything. They're so busy. They probably, so.
And to add with that is you have to have empathy for them, right?
Right.
And the reason why empathy is such an important thing is because that, you start thinking about it like, wait, something negative happened to you today. Maybe something bad happened that the negative energy just got transferred to you that day, that you were the person that made her blow up. That one instance that you were the one. And she just needed to let it out and you just got it. Because I always look at like, if somebody's having a bad day, I didn't really cause it. Because once you start thinking like, well, what did I do? I just asked her out. So the question I started asking like, something happened with her kids. It's just like, was there a snowball effect? Was there an avalanche that happened that literally it got on me? And yeah, they may not remember it, right? And so that's perfectly fine. So you just go back in and you keep on going. And once again, even if I lose a facility, I don't care, right? I care, but I don't care. I don't know if you get the both sides of it, right? I care that I lose it because it's, but I don't care because I know I can get another one. You start feeling bad more when you lose one, but you don't know how to replace it, right? And you're like, oh crap, how do I replace it? But once you have the process and you're like, oh, I can replace it, you're gonna feel bad, but not really, because now you can replace it.
Right.
So once you have that thinking that way, like, all right, okay, so there you go. Here, for me to replace this, here goes me adding another person for my eight-time visit for 2 months, right? Oh well, okay, fine, let's do this again. And so that's where you just increase it, And then what's gonna amaze you is this: you're starting to figure things out, you're starting to see things, you're starting to self-analyze. There's gonna be a point where you're then gonna be able to predict what they're gonna do. There's gonna be like, I know this person's gonna say that. Oh, I just said this, and that's how they react. Like, and you start seeing it happening in front of you. It becomes slow-mo. You're like, this person's about to tell me this, and they say it, and you're like, knew it. And so you start predicting, and you're like, oh, I know this is what's gonna happen. And so when you can actually predict, then you went to your next level of learning, because now you're like, oh, I'm predicting things now. So now it's starting to make sense. So once you have that first prediction, you're like, oh, okay, I'm starting to hit a thing. You just keep at it. And so once again, it just goes back on your closing techniques. Pick a good 10, pick, for objection blocking, pick your top 5 and stuff like that. Closing, the scale of 1 to 10, that's one of my favorite ones. Then you go after pretty much the what if close. What if I can do this for you? When would you want to start working with our company? There's like so many things you start adding, and so that's where really you need to have. And so, and this is going to be a process for you, man. It's going to, and that's why, I'm glad, that you did the Platinums package, because we can talk once a month and stuff like that, because this is where really what happens, because you're going to hit a part where you're going to jump really high, and you're going to once you hit that momentum, you're going to go up. But I promise you, once you start seeing the uptick happens within 90 days of that, you're going to hit a plateau. Because then it's a matter of like, what you're doing now to what you're going to do 3 months from now, we're going to have to revise certain things. And like, hey, you're doing this, great. Step back a little bit because you need to do this. And it's all about just continuously somebody telling you what you need to do. And that's where a lot of agencies, even, large agencies like yourselves, they forget that process of like, they start looking at the numbers. Hey, yeah, you're doing good. You're doing better. That's great. But, for me wise as a coach, it's like, how are you? That's the main thing. It's like, where are you? What's your mindset right now? Because if you had a mindset like, Michael, I'm happy with 30, right? Like, I'm happy getting 30 a month. Then I'm going to be like, all right, let's keep you at 30 because you're happy there. Now I'm going to be like, well, trying to make you sense. I'm like, well, if your 30 is really a mark, let's try to go for 40. So that at least you go up sometimes and you go down. Because if you hit 30 and that's where you want and you're happy, you're going to go back to 20 eventually. So, so it's just me adjusting you a little bit and saying, this is where we are and what we need to do. So that's it, man. It's just, 3 right away. You use a few techniques. Imagine if you now start really having all of it in you. Imagine if you perfect your prospect and you have the, meaning that you have all these telehealth stuff that you printed out, knowing really which one you're going to target, start writing down the CPOs, prospecting. Then then remember, your qualification still sucks because you can't remember those two questions, right? So, and you're presenting. So once you get those, once it becomes like, once again, what are 3 things to make you choose to work with agencies in the past? What are the 3 things that those agencies can improve on to provide better care for you and take care of, your patients well? What would those be? Once those things just like this comes out of your mouth, so like, see, I can say it really rapidly because it's like it's ingrained in my system. I know it by heart. So once it's there, and I need to bring this, right? And remember, I talked to you about if you hit an objection, if they say like, we're already working with other agencies. Hey, you know what? I truly understand that you're working with other agencies. The moment I walked in that door, I knew that you guys are working with other agencies because you guys have been around. Now, other than the fact that you're working with other agencies, what 3 things that made you choose to work with those agencies in the past? Once again, I plugged it in. They're going to hit me with objections. Bam. I'm going to go back into the question, rather than go out and be like, all right, well, can I drop off my flyers? But, no, I'm here to find out these two main questions. This is my qualification, because I may hit objections after my qualification phase that I might have to come back another day. But I need information. I need these two main information before I walk out the door, because this is my follow-up. I need to go back in. So once you walk in, you have the DM in front of you, the decision maker in front of you. Your goal is to get those two questions out and get the answers.
I like that.
That's the only thing that you need. If you get in front of the decision maker, you need to be able to get those. If you go in front of the gatekeeper, and no matter what you do, you can't get past the gatekeeper and get into the decision maker. You have one goal, is to get the decision maker's name, a business card, an email, direct number. You have to leave. Every time you walk in, the purpose is to gain information. You can't walk in, get stuck at the gatekeeper, and walk out not even knowing the name of the decision maker, not even knowing, contact information, right? Because if you walk out that way, you lost.
Right.
If you meet a decision maker and you can't ask those two questions, you lost. Right? That's a waste of the day, right? And then it goes to the part of, if you do a presentation, right? In the presentation, you can start delivering the stuff more. And if you don't deliver everything correctly or get more information from them, right, then you lost. Right? So every part of the process, the goal is to get something that you need in each portion. Qualification. And even when it starts to closing, did you close them? Did you get stuck with the first close? Once you have all that right there in your CRM and what you need to put together is what's going to create success for you. All right?
So, actually, I just remembered that there is something important. Do you have a little bit more time? Okay, so my goal for this week is the closing. I really need to do that. I really need to go into the facilities, because I know that they've been warm in the past. It's just we've had some service issues getting them started, me finding out about the referral later. Now I've gone up and gotten most of their phone numbers now, so I can know. I said, hey, text me if there's a referral. But at this point, I need to go in there, and because I know that there are referrals.
Okay.
So I need to go there and and get the patients out. So I like that there's some videos, a video series where it's a little bit more advanced, where it's like, okay, other than the fact that you what was it? See, I need to practice.
So I right there, you're looking at a closing video. You're looking at the objection video. So, other than the fact, meaning that's you hit an objection. An objection is like, other than the fact that, totally agree. Other than the fact that that's your objection, right? Is there any other reason that we can't talk more about this? Other than the fact, right? So, hey, perfectly understand that you're busy. Other than the fact that you're busy, is there any other reason other than that you're busy that we cannot have 30 seconds right now to talk?
So there's a video. There's a video where you got specific about actually getting a commitment like right then and there. Like,
you have to tell me. So
oh my gosh.
I'll give you a quick thing. There's so much information that I have that I've been putting out that I watch my own videos, because I'm like, what was that one time? Because like sometimes when I market, and I'm like, what was that one technique I did that really got me? And then so sometimes we have to look back. I'm a person who's stuck in my own ways. I know my closes as much as I can, but at the very same time as I forget them as well, because I stick to my 20 my favorite 20. But that doesn't mean that that's why even I review my closing, is when I look at it, I'm like, oh, that was a good one. And I can even remember where I used it, whom I used it with, because that's how it goes. So it got more specific about what.
So I don't feel bad for not remembering it now. Okay, so it was about there's usually two reasons why you won't give me a patient right now. Either because you don't trust me.
Yeah, so okay.
So that's what I need to do.
I'm like, listen, I know that you're busy. I know that you're working with other agencies. Now, other than the fact that I'm talking to you right now, there's really, the truth is this. Most people have 3 reasons to not want to work with us. Number 1, they don't know much about our services yet. Number 2, they don't trust us yet. Or number 3, they don't have any patience. Which one is you? Which one are you? What I'm doing there is I'm like, tell me that you don't want to use my services. Because what happens is if they say something like, for example, no, Michael, I trust you, or perfect. So the fact that you trust me, which of the other 2 is not? So remember the 3 choices? I'm cornering you, right? If they say something like, for example, no, I understand the services. Oh, great. Well, if you understand the services, do you trust me? Yes. Okay. Perfect.
Can we do a role play, a reverse role play?
Yeah, sure.
I want to see what you, so I can learn what you would do. Okay.
Sure.
So let's say you're me. You're with a big company. You've like woken up, right? You know what you need to do, but you need referrals like now. You need patients to get admitted now, right? So pretend like I'm a mean case manager at a hospital, and it's a closed hospital and you can't be there without a patient, whatever, but you still need to get to me. So you need Medicare referrals.
So I'm gonna, now you have to be honest. Did I do my presentation yet already?
Did you no, but they used this before.
Huh?
No, but it's like they've used this before.
They've used this before.
Does that make sense?
Okay. So I used to get referrals. I used to get referrals from you guys.
Okay. How long ago?
Yeah. Just so I get
there a lot of actually, like last week, but they're crappy referrals. They're ones that we can't service because of payer source, and I've had to forward them. They're not qualified referrals for my company. They're not Medicare, and unfortunately, that's what I need to focus on, especially for this week. The Medicare referral.
What's the process if in your facility of a patient not being accepted?
Usually the Medicares always get accepted, and we just assume that they don't have another agency. We just say accept to the discharge planners. So we'll deal with it later.
How about the ones that get denied?
I have to. They said deny, notify referral source, and then I have to notify them, and that's when I have backup agencies and I send it off elsewhere. Okay. But that takes a lot of time and energy, and it's something that I.
Okay. So do you have your top 3 agencies that you refer to?
Yes, I do.
So what I would do is that walk in and be like so I got a referral from, hey, like, listen, just wanted to discuss with you. I know that we took some patients from you last weekend that unfortunately because we couldn't accept the patients, but we made sure that we followed through and was able to find the right agencies that's going to be able to provide the care for them. Other than those, I want to be able to touch base with you, and once again, what's going on this week? Is there anything that we can do and help out with your patients at this moment? Do you have any family members that maybe we can discuss with that are not too sure about services that we can do to help them? But other than the family and other than the patient, how are you doing, by the way? I mean, is there anything that I can do for you to make your life easier, make your time, more valuable?
I'm really busy right now. Do you guys take WellMed, HMO?
What? I don't take those, right?
You don't take those.
No.
We don't have that much Medicare for you.
That's great and all. The truth is this. When I looked at some of the reports and stuff like that, and WellMed's a great thing. Other than the fact that WellMed is is something that you need. What I want to do is I want to be your funnel. I want to be the person that you call, no matter what type of patients it is. And if we can't staff them, the reason why I want to be here is I want you to send them all to me. And if we can't staff them, I'm gonna let you know. But other than the fact of me letting you know we can't staff them, is by the time I let you know, I already have another agency that can actually handle it. Now, other than the WellMed, I looked at some reports. I know right now at this very moment you don't have a lot of Medicare patients. You may say that, but like for example, last quarter you were averaging this much amount of referrals, and I know at this very same time as at this moment you're working with 3 agencies, A, B, C, right? Now, with those agencies, are you being since are your top referral sources? You know, I just want to be able to know what are the three things that made you choose to work with those agencies that they do for you.
Mm.
Now, if there are three things that they can improve on to provide better care for the patients, which is a big thing, and provide care for you, take great care of you, you know, what would those be? Now, you know, the fact that you shared these 6 items with me is such an important thing for me at this very moment. And, you know, if you are just like the other companies that I work with, you know, when a patient gets admitted, discharge planning begins ahead of time. So other than the fact that, you know, you don't have any patients right now because more likely they've been referred to an agency already,
Mm-hmm.
are there any patients right now that potentially you would want us to follow up through right now, maybe talk to, so that in a week or 2 weeks when they're about to be discharged, that we can begin the process? Because the thing though is we don't mind taking last minute referrals. And what's amazing is you're going to love me and you're going to enjoy working with me because you can call me on a Friday afternoon and we'll take care of that for you. But here's my main thing is to provide better care. I want to be the first choice, but you don't have to make me your first choice. I don't mind being second because I want to provide you guys great service. So other than me talking right now, what can we do at this very moment, you know, to be able to start working together? Now, typically there are three things that, you know, that people make a decision on wanting to work with us.
Mm-hmm.
Number one, you know, maybe they really don't like us. That's why they don't want to work with us. Number two is maybe they don't understand us. And number three is maybe, you know, they need more information. Which one of those three is you at this very moment, since we're at this you know, point? And so now, like, they're not going to go for what? They're not going to go for I don't like.
They're not gonna go for. No, I do like you.
They're more likely, you know, that they want to know more. But I've heard it where they say, "Well, I don't like you." Right?
Okay.
You know, and so when somebody says, "Well, I don't like you," hey, listen, I appreciate the fact that you are honest with me and tell me that you don't like me. You know, but just like anything else, you know, in the beginning, we may not like people right away, but you end up liking them. You know, so it's like you can go past a lot of these objections and just once again, whatever objection hit, address and counter up, right? Or, you know, there are three things that would make you that there's three things right now that's going to make you want to work by the agency. Number one is that, you know, A, B, C. Number one, it's because you love our services. It's because looking at our services, something is good for your patient. Number two, you know, you're still at the point that, you know, what decision should you make? You know, you want to work with us, but then at the same time as you're working with other agencies. Number three, you know, you're just really blank right now, this very moment, and you're just too busy. Which one of it is it for you? So I can go with positive and I can go with negative.
Oh, this is awesome because you're cornering them.
Yeah,
Also.
exactly. That's what it is. I'm cornering.
And you're being aggressive, but you're not being like the way you're wording it is not offensive to them.
I'm giving them choices.
Right.
Aggressive
awesome.
is like, you don't like me, or aggressive is like, give me patience because you like me. You know, but maybe giving you choices. And then what's amazing about it is it's when you start giving people choices, it allows you to, number one, start being more, you know, getting more information, like finding more about them,
Mm-hmm.
right? You know, and if I'm able to find out more about them, then the relationship actually happens.
Mm-hmm.
Then the stuff of trust begins because you're wanting to ask questions that most marketers don't even want to ask.
Right? Those things have been the most fun for me. Listening to your videos and applying some of them. I still haven't, you know, fully. I've been writing some scripts on what to say.
Mm-hmm.
But those are the most fun, getting over the objections and asking the hard questions because I haven't done it before, so it's actually quite interesting for me to see what happens and then to block that objection and nothing. I mean, what do I have to lose, right? It's either you get the referral or you don't, and you lose your job.
It's either
so
you get stuck in the first objection and don't continue, quit, or you address the objection and go past it and get the next objection and go past it again.
Mm-hmm.
Because each objection is the barrier, right? Just like, you know, I try to use I try to use the whole menu thing as an explainer for people. When you go to the restaurant and you open up the menu, right? You know, you said yes to the food that you ate, right? That you ordered, right? But the truth is, you said 1,000 no's before you said that one yes. You said no to the first entree. You said no to this. Heck, when you finally chose that steak, you said no to the potatoes instead of the fries. You know, you took the so there's all these no's that happens. The question that we need to be able to figure out in the whole system is, where are all your no's? When you're getting the no's, okay, no, barrier, get past, next no. And then once you have the path, eventually you're gonna get the yes, right? So remember I talked to you about
this is so much fun. I'm telling you, like this objection thing, I'm really having fun with it.
The people that really understand objection.
And I think I lost you. Oh, okay. Yeah. You froze for a little bit, but
what's that?
Okay, I think I got you. Okay.
Okay.
Yeah, I was saying how much fun the objection, just learning how to get past it. Now when I think about it and when I implement it, I think, oh, that's nothing bad is gonna happen really. And like I know what to expect. You know, if they do get mad, like you were saying, you're gonna know. I love that you're gonna know what to expect when you get really good at it. So,
and even just like how you brought up, like, you know, well, Mike, there's this one objection, you know, closing technique you did, and I was like, okay, so tell me more about it. And so what happens is once you have the premise of the whole closings, you're not going to say things verbatim. I mean, some of them you can just say verbatim. I mean, probably some of the closes I said, you're like, okay, he said that just like how he said it in the video, because it's just easier. But the question is, when you know the skeleton part of it, the basis of it, then you can play around with it and use it. But that's the main thing, and that's why even I enjoy the videos that I have, is because I forget my own closes sometimes, and I'm like, well, what's that one close that I love using? You know, because I'll have, like, for example, certain clothes that I love during the season. I like using it around this time, or I like using it this time. So, but once you start knowing a good 30, 40, 100 of them, if you want to, and have the basis, when it comes up, you're like, oh, this works well for this. You know, and so, you know, if you end up working with somebody with that does closing as well, you're gonna be like my team will have challenges. They'll say, like, I think I told you this. They're like, you can only use these closes today. And you have to stack them this way. Like, they'll give them challenge, like, this is how you stack them. I want you to stack them this, and some of them will just make fun of it and like use the worst closes, the worst combination of closes together. Like, sometimes it doesn't make sense. But what the funny part about the whole thing is that they still work, because that's still the same process.
Can you give me an example of using closes that don't go together and stacking them?
One thing that you never, you know, so it's like, you don't want to go with multiple aggressive closes, right? You don't want to be like, you know, I mean, you know, so by now, if you realize that, you know, you enjoy our services, when would you want to start at this very moment? You want to give me a referral today, tomorrow, or Wednesday? You know, I'm like, straight up, like, you don't want to use that. You know, like, that one is like, you don't want to use that, for example, in the beginning of your follow-ups, right? You use that towards the end. Be like, when you have a little bit more rapport. But sometimes we're just gonna be like, the first visit, close them with that. Like, the first visit, like normally you use that on a follow-up, but we'll sometimes say, we want you to do it in a presentation.
It's so funny you say that.
So we'll say something like, you know, by the end of this presentation, you're going to understand more about our company and why we can provide better care. So before we even end the presentation, is there anything at this very moment that we can add? And if you want, are you going to want to give us a referral now, after the presentation, or tomorrow? Now, this is like straight up, like, you know, once you have enough, as they say, it's like enough I don't care presence. Once your funnel is, once you hit that 30 referrals a month, then you start playing games. Then, because once you, as we can say, once you're stable in your job, right? Once you're like, okay, I'm good, then you can start playing the games. It'll be like, let me see the bolder the better. You know, I'm like, let me just, you know, because if I lose this doctor, who cares? You're my practice doctors. And sometimes what ends up happening is once you start looking at, like, if you use Trello, once you look at the ones who are the harder to sell thing, is you're going to use them as your first visits of the day. So they're your warm-ups. because the ones in the afternoons are the most valuable ones for you. So let me just warm up my system by just messing it up. And how do I mess things up? I'm going to mess it up so bad by using the hardest, boldest closes. And so then I feel better, because then you know, like, okay, I just really burned it because I did it this way. But here's the fun part. We've seen it happen where you use bold closes and it just works right there and then.
I was going to say that.
And then you're just like,
could work. You never know. I love it.
We hate that part, because if you use bold close in the beginning of the day and it works, psychology happens where it's bold closes all through the day, and you just go downhill. So it's it's a psychological game. You can never use it. It's just more of those, like, let me see if it works. But what happens is it's called pattern recognition, where what happens is, so this type of physician, from how I see him, how he walks, how he talks, this is how it works for him. So if I see the same pattern in another physician, then maybe that type of bold will work for him. So once you start having what they call pattern recognition and all those things, that's when it starts really being a little bit better. Bold closes are really, really something that you shouldn't use in the beginning. It should be used somewhere when there's, it's like if you have a brother, if you have a sister, right? You can be a little obnoxious to them. You can be a little bit more crazy to them. And they're like, yeah, what can I do? Like, it's my sister, it's my brother. And that's just them. So, but when you first meet somebody that, is not considered a friend, not even an acquaintance yet, you don't want to be like a bad person and be bold, because they may not see that that's who you are as a person yet. And they're like, I just don't like this person. So those are the things that ends up happening. So you just have to really, the objections, the closings are such an important thing and should be used all throughout. And you don't want to start closing towards the end. Closing starts happening in the beginning, just like discharges. Before we even get started, doctor, if you enjoy a presentation other than yourself that would enjoy probably your services, is there somebody that you feel that would enjoy your services as well? If he gives you yes and he get their information, says no, then okay, whatever, let's move on. Same thing. So, paying attention to what your future pacings are. Remember, we talked about future pacing a little bit. Story questions. Imagine this weekend that you have a referral that you need to do. All you need to do is dial that number. What you're doing there is you're planting a picture in their mind of, like, them all of a sudden in a weekend needing to call someone for referrals. Right? So, so, like, for example, I'll say something like, so I'll even use what they call, position stories, meaning that, as you're sitting there in your desk at this very moment, and I'm here in front of you, and we're having this conversation about, and so what I'm doing is I'm like, we're living in the moment. It's like, I think I used the analogy last time we spoke about marketing and sales is like dating.
Yes.
And so, when couples are dating, when you have two people together, they start future pacing. They start like, oh, imagine one of these days we're going to travel to Australia. Imagine one of these days when we get married, we're going to be in the beach and stuff like that. Everyone future paces. Loved ones, friends. Hey, bro, when remember? Imagine this, bro. We're going to go to New York. We're going to do this. We're going to Miami. All this. Friends do that. So what you do is you give them the same exact stuff. Like, imagine. What if? If there's one thing that we can do at this very moment. And so when you then attach that to your presentation and your talk, then that is the most powerful thing, because now you're talking their language, friendships, trust. Only people that trust each other and know each other talk that way. The ones who you're like are the ones who are like, well, what can we do for you? No, change the game. But here's the funny part. I can talk about this. This is what needs to happen. 95% of people are not going to do it. Right? So the question is, might as well do it. Might as well try it out. And try it more than once. Because what's the difference of me telling somebody, like, do a storytelling in your presentation, to you reading a bullet point PowerPoint presentation of just talking nonsense about the company? Let's live in the moment. Like, let's talk about, what we're doing, but make it into a story. I can say, for example, Well, what happens is the first step is you call this number. The first step is you call this number, and once you call that number, you're going to speak to somebody in the office, and and what you can do is you can, or if you want, you can fax the information to our fax number at so, and then once we get it, we'll notify you. Or I can say something like, just imagine this: you have a referral right now. It's one of those patients that that you're having problems to find the right home health with, and the family has some difficulties. And all you have to do is just go ahead and fax it to 555-1212. And once you fax it, once you press those buttons, once you chose those buttons and fax it to us, it's going to arrive to us. And Janet at the office, like, her main job is to look at that fax number. And when she gets that fax, Miss Referral Source, what happens is we go ahead and enter it to make sure, is the patient qualified for the right insurances? Because there are times where patient says they have Medicare Part A, but really they don't. But we're going to go ahead and check it. And once that's checked, within less than 15, 20 minutes, we're going to notify you right away. And once we notify you, the moment we notify you, you say yes, then we got the doctor's order. The first thing we're going to do right away is that we're going to make sure we find the right nurse to be able to make sure we visit that patient within 24 hours. Now, sometimes it does take 48 hours max. And the reason for that is that more likely 90% of the time is because the family member is not there. And so there's some logistic problems. But typically, we see the patient within that first 24 hours. Now, if there's any problems, like, for example, DME, and that's, trust me, Janet, let's say her name is Janet, right? Trust me, Janet, doing this for a long time is working with other referral sources. One of their biggest problems is DMEs. But what's amazing is that there's a DME company that we work with. And that company, we have a strong connection. And that strong connection that we have with that DME allows us to be able to really, shorten the potential of having problems. So as you see, I'm telling a story, And
I'm thinking about how to apply it right now. Like,
Janet, I know one thing for a fact is that you are tired of actually calling 2, 3, 4 home health agencies. At this very moment, Janet, before you even walked in, I know you're working with other agencies. And here's the funny part. I know the top 3 agencies you're referring to is A, B, C. And listen, I'm not trying to be the only choice. I want you to have choices. Best thing in life is having choices. And having the right choices is the most important thing. Janet, do you agree? Yes? Okay. And so what you start seeing in the presentation that we do is that I'm going to make you start saying yeses. Like, imagine if this, wouldn't that be amazing for you, Janet? Yeah, it would be amazing. I mean, because if it's not amazing, so what I'm doing here, I'm literally starting to say, I'm making you nod yes, yes. Don't you want to work with a company that has a good relationship with their DME company so you're not having problems? Yeah. My part of my presentation is to make you say yes nonstop. Yes, yes. Yes, 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 yes. If I make you say multiple yeses in a row, then I say, when won't be a good time to start working with us, Janet? So that's the thing. If I can get you to say yeses so many times, it's a lot easier to say yes to my closes. The purpose of the closes is they make you say yes. I need you to say yes all throughout this presentation.
That's so cool. Right? Wow.
So instead of me saying, we're going to do this, we're going to do this, we're going to do that, I'm going to give you a story, and also what it's called trial closes. And trial closes is for you to ask minimal questions that makes them say yes. Because if I can make you say yes and make you comfortable to say yes all throughout my presentation with all the different trial closes, then at the end, there's no other, so that's where you don't forget, you still need to close in the end. So when would be a good time to start working with us? Or when would be a good time for me to maybe see one of your patients right now, or maybe have a hard problem? Because, and you can even add like, hey, Jen, look, I know one thing is that if you haven't worked with us yet, and any first companies that you first work with, you've given them a hard patient. That first patient sometimes, if you're just like other agencies, they try us for the first time, they give us the hardest patient they have. And the reason why it's the hardest patient is because every single agency they called said no. And the truth is, Janet, I'm not going to say no to that first patient. But one thing I'm going to do is, I'm going to work hard to make sure that patient gets taken care of. The funny part is, Janet, is the work that I do to provide care for that patient.
Yes, it's the same amount of energy that's gonna
do for every patient.
Yes.
Because Janet, I don't want to lose you. I don't want to be your number one choice. So what that does is it's showing me that me being humble. I don't need to be your number one choice. I don't need to be your number two choice. What I really want to do is I want to be your number three. But what I really, in the end, in 3 months from now, is that I work so hard that I become your number one choice. But I still want you to have multiple choices. Because that's good for you. Because imagine, Janet, if I become your number three, the other company is going to see that and they're going to work hard for you. They're going to work hard. The second person to work hard. I'm going to work hard. But guess who's going to work harder? Me, because I want to be number one. But let's worry about me being number one 3 months from now. Right now, right here is the main question. When do you want me to start taking care of one of your hardest patients right now? Right? Is it a wound care? Is it a wound vac? What is it? I'll do it. And Janet, if you even have problems, because I know you're busy, if you want, I'll go make the photocopy for you. Like I'm straight up just gonna like, and what happens is they don't see what's going on. They're like, whoa, what? Storytelling? Storytelling is the presentations, technique. People that keeps on using PowerPoints and bullet points is gonna lose.
God, I love this. Yes.
That's where they lose. That's why we have videos for each one of our presentations. It's in a video format. Why is it in a video format? Because we tell stories. And once we can have the conversation, and that's why video emails, video text messages is such an important thing for us nowadays, because it's such a cool thing. It's because it becomes more personal. Text messages are nice, but it's not as personal as video. It can even be to the part that you send somebody a text message, but you send them a voice text. Right? And so those are the most important things. But presentation, man, it's all imagine, what if, can you...
You know what's so interesting? I'm gonna just quick note. So it's so interesting. So my company Kindred taught us storytelling, but not storytelling with the customer, with the decision maker, storytelling with the patient. Like they taught us they taught us to tell the decision maker who's in charge of discharging whatever the story about a patient. But I like that you're making it about the customer, storytelling about the customer. Imagine this. I mean, I'm loving it.
Once again, it's not about the patient right now. It's about the person you're selling to. That's where it is. Selling is selling. I need to sell you first before I get a patient. Right? And that's just where it is. It's like, let me sell you. Let me, it's not even selling, but let me paint a picture of what it is if you start working with me. Even to the part like, the moment you decided to fax something to us, you start pressing those buttons, and you dial fax number, and I literally will say 555-1212, whatever your fax number is. When we press enter and it gets sent, it's going to go to someone in the office. And so once you do the storytelling, it paints a picture of the whole process. Then just like any storytelling system, when you're telling a story, right? There's the knight in shining armor and the princess that needs help saving. And you're the knight in shining armor that's going to help the princess, which is them. You're the hero of the story. Is the whole part. Like, you're the hero of the story. Like, I'm going to do this for you. I'm going to handhold you. I value your time. And so you start bringing the closes in there, and all of a sudden people are like, oh crap, right? Okay, that's amazing. And so they they absorb stuff more with the storytelling thing. And like I said, asking what they call trial closes. Every time, like, hey, would this work for you? wouldn't it be amazing that, when you have that one call person, once again, yes. I'm not going to ask you questions like no bold, like yes. The most important thing is getting a yes. They say there's closed-ended questions and open-ended questions, right? These are more closed-ended questions because it's a yes or a no. But if a person says no, they don't want somebody that has good contact with their DME, that's impossible.
Right, yeah.
I'm literally going to say all the good stuff that you expect from a home health. Once again, remember, 3 things that made you choose with an agency, 3 things that they can do better. Your storytelling is part of those 3 things. That's it. So imagine contact. They have problems. Then you put that in your story. You want somebody who has good communication, right? This is the steps for communication. So they want somebody who can admit somebody in 24 hours. I just told you in that story. They want somebody that, that can accept Medicare patients. I'm like, listen, talk about if you have a patient with Medicare, that's something that we accept, but at the same time, I want to be the funnel. I want to be the one person that you call. Why would you want to call 3 numbers when you call that one number? If no matter what, I will find, if I can't handle it or staff it for you, I'm going to make sure that when I call you that we can't do it, I found another agency that can actually do it for you. Now, one of the biggest objections for you is like, why do I want to give it to another agency? They might try to steal this referral source, right?
Yeah.
Right. But the funny part about that is, if they were bold enough, why didn't they go into the hospital? So they're not good at it yet.
Right. And I also remember you saying that there's another video where you said something about you not even being afraid of that happening because you're so good. You're confident enough that you can have, your competitor is fine. You can, like, that's what I'm tying it into. I'm confident enough where it's okay if they have to make contact with the referral source. They're not going to, it's just one contact. They're probably not even going to follow up because most marketers don't even follow up. I'm the one that's going to follow up.
Don't worry about it, because no matter what, if they wanted that hospital, they would have had that hospital ready.
Right.
If they wanted that hospital, they would have had it already. And by the way, it's not like you're giving the hospital the number of that home health.
Right.
So that's one thing. Number 2 is, if you're going to fax that home health information, take the cover page off. So they don't see it, the cover page that came from the hospital.
Oh, okay.
Right?
Yeah.
So, there's ways to control the information, right? There's ways to do it. There's a variety of different ways, and you just have to be smart about it. And not just even being smart about it, is you just end up figuring it out, because as you go, how do I know about the removing the cover page thing? Well, because it took me a while to come like, wait a minute, I've referred so many, and I've seen my competition try to go into facilities that I gave them a referral from. Right? So how do I remove that? Here you go. So there's just so many ways. And at the same time, is how does that facility know that they have patients to give? Because I'm giving you this type of patient. And once again, is if you know how hard it took you and what type of objections you had to face to get in front of that referral source, that facility who's going to try to get into there is going to face the same exact problems.
Yes.
If they're going to face the same exact problems, what if they have a really bad marketer? Because if they had a good marketer, that marketer would have been in there already. You see, so having that mindset is like, I'm already in. Forget you. I already beat you. I already know better.
And at the same time, I'm now remembering, once you get that first referral, you still have to follow up. Otherwise, you'll be that other marketer that would already have been there just because you get the referral. See, all of your videos, they tie in to one another. I think of one thing
Exactly. I'm glad that you figured that. And that's exactly what the videos are meant for. It's meant for, and I'll be honest, like, we have so much stuff, and we've even realized the fact that people sometimes don't even get to tie them together. People don't realize, I'm like, okay, so we are having to now, like I said, we're making the webinar for the bootcamp. The bootcamp stuff, the one I'm going to share with you, it's not actually going to be it's not going to be your platinum series, because it's a separate program. we're selling it separately for $2.99. So it's something completely that's going to be sold $2.99. It's not going to get launched till like about next month. So I'll get you access to those links. So it's like I said, 7 hours worth of stuff, and that literally will. And there's a portion there talking about software like Trello and the other software as well. We didn't mention the name Trello in there, but it's like saying this is how I would use it. But there's just so much. I mean, I can talk. I mean, look, we have this conversation right now. It's been going what? 2.5 hours. So yeah, so 2.5 hours, right? We've had 2.5 hours conversations. Dude, I can still keep on talking for hours and hours on how to fix things, right? So that's the thing, man. It's just, there's just so much information, and don't overdo it. Do tidbits. When you're driving between scenes, just listen to a couple of things, make sense, and be like, oh, that works. That might work here. Let me try it. Or it might work for my next one. Or imagine you hear something, and then it doesn't make sense yet when you go to your next visit, but then maybe towards the end of the day, like, wait, it makes that close or that thing actually works for this right now, this situation. Let me try it. So it's just always constantly trying to remind you and stuff. And that's it, man. I mean, that's all I can say. It's just don't, but once again, you figured out the moment we started this conversation today, it was about the follow-up, and you saw that. And really the truth is everything is in the follow-up. It just is. Mm-hmm. You have a higher conversion rate if you follow up every week. You have a higher conversion rate even if you follow up every 3 weeks, but do it for several months. You're going to have a higher rate if you visit more than 2, higher rate more than 3, higher rate, your closes are going to be more just by numbers. Mm-hmm. But having the right tools, the right presentation, the right closing techniques incorporated into a shorter sales cycle or a nice follow-up system, it's just even better. So your emails are, like I said, I'll send you a thing with for the that I use for emailing. I'll send you a link on it, and I mean, if later on you want to try it. Like, I swear to God, just try it. And then, like, if you don't want to do it, just don't do it no more. Just like cancel on it. But the funny part about the whole thing is that once you have somebody that already knows how to create emails, once you know how, there's like so many things that you can use. I mean, like, we use it for funnel systems. We use so many different things. Like we have each one of our marketers have their own funnel. Like they have their own set, and they'll make a mini website for themselves.
That's awesome.
Yeah, they'll make a mini website, and in that website they'll have a video and be like, hey, you know what? Yeah, stop by your office. So they'll have like what they call a cold visit video. They have a warm visit video. And so if they haven't seen the person, they'll send them a video. Say, hey, I stopped by your facility today, and I noticed you're really, really. And then we start going through the process in the video. If you want me to stop by, within the next few days, if you want, you can click the button below. Just put your email. You can even choose to put the next button. You can choose the time and date that you want me to show up, because it has their Calendly account in there. So all my marketers have what they call a Calendly account, where they already know who their visits are for the week, so that anybody who wants to set up an appointment for them from there, if all of a sudden somebody sets up an appointment, it goes to your Calendly appointment, and they know that they're want to set it up or have a quick call, how I can do this. And same thing, do the presentation. And so having all that, allows us to straight up like shorten the sales cycle, because, maybe they're too busy, right? And they saw the video. Right?
Yeah.
You see what I'm saying? So we're going to try to sell you through email, through video, and every single possibility ways to address things. Same exact thing. If we have your text message, the video that we have for our text message, we send you the link, and all of a sudden you're watching hey, stop by earlier on today. I got yours. Just to let you know, I got you. Because if we know that video that we send them in their text message is the first time they see us, when their text message, hey, just to let you know, we got your text message. We got your cell number from your business card. And first of all, I apologize if we're sending this to you, but I just want to be able to say I stopped by. And so once again, sales process begins. Because we don't want them to wonder, like, how the hell did they get my cell number? No, it's in your business card, fool. That's why I got it. So I'm not trying to steal it. You put it there, so I'm sending you information here. So there's just different things that you can do. It's just crazy, man, on things that you can have in this business, in this marketing. And what the funny part is, most agencies are not even doing a quarter of what my team does on what we teach. Most Most marketers are not. I mean, even large organizations like yours are still not doing this. If are still not doing a quarter of what we can do. You guys have tactics, but you guys don't have the strategies on it.
Right.
So, you know, the thing though is that there's always room for improvement. Like if the companies are doing, like, you know, in my agencies, 5 of my guys are producing 100 referrals a month. I have 5 guys doing 100 referrals a month. I have one of those, and I'm talking about, you know, I'm talking about 3 guys are doing about 150 referrals a month.
Like for one branch?
For 3 branches.
Okay, I was gonna say, whoa, that is so much bigger than Kindred if that was for one branch. Whoa.
You know, it's 3 different locations and stuff like that.
That's still a ton. If you have, I mean, that's very.
Yeah. Do I want to grow more? The truth is, no. You know, I'm satisfied with agencies that hit around 250 to 300. If we have around 250 to 300, I'm perfectly satisfied. And the reason for that is because we're at a growth spurt where if I take in new people, the amount of stuff that's going to happen is we're going to end up losing a little bit. So for the next 2, and I don't feel like doing any loss for the next 2 years for now, because I'm doing some rebranding. We are in talks of several companies purchasing us out. So I don't want to overdo it because, you know, so if these companies decide to purchase us out, then we're perfectly happy where we are. But it's, you know, my companies are being sold as a package, not as a separate. Some companies want to buy one and then the other, and I don't want that. So, you know, it's just, you know, man, it's just, there's so many things that you guys, like Kindred probably averages what, 200 a month? In Texas, you gotta be around 400 or 500 patients a month.
So yeah, well, with that branch, so all the marketers bring in like 30 referrals, and there's 6 of us.
Yeah, you're on.
I'm the only one that's doing crappy right now at this moment, but
you guys are probably around 300, 400 Kindred.
Yes,
okay.
That's it. Actually, yeah, that was it.
Yeah, you know, I mean, what's funny is my marketers, like for example, I tell my marketers, I'm like, you guys can open up your own agencies and have, you know, and become happy. But what's funny is that they make good money enough that they don't want to. That marketer that I told you that the marketer I told you that I got from Starbucks, I mean, he quit and became a doctor. I told him, I don't know why you make more money than a doctor.
Really?
Yeah, he was making 170 a year. So, you know, but that's because, you know, he was, at one point he was hitting somewhere around 130 or so referrals. So, you know, it's like, you're making that much. Why do you want to be a doctor? Well, he wants to make his mom happy. All right, make your mom happy. You know, he just graduated last year. You know what he's doing now?
What is he doing?
He's marketing for home health now.
Are you serious? Dude, I just thought about that yesterday. I was like, wouldn't it be interesting if a doctor marketed for home health?
Yeah.
Like,
he bought his own home health agency. Right? He's got his own practice. He's still doing his his residency now, right? So he's doing his residency right now, and he's marketing.
That's amazing.
He's marketing. So, you know.
That is so cool.
But, you know, he knows the rules. He's not going to make a mistake. I appreciate him. He knows that he can't have patients and refer it to his own agency. So, right. You know, he's aware of that. He's an ethical kid. And, you know, worst part about it, you know, I got him from Starbucks and now I have to call him doctor.
That's so funny.
But he's like my little brother, you know. And by the way, med school, fully paid. No student loan.
With the home health?
Because
that's amazing.
Because he was able to save up money for when he worked for me for 4 years, that he was able to pay for med school, you know, fully paid, which I told him he's an idiot because he should have gotten loans and then not pay them back. But I mean, you know, and so I just say, you know, listen, I mean, you know, he's marketing now. He has his own agency. He bought an agency for $30,000. So, yeah. So, he's been marketing that agency. He doesn't live here now. He doesn't live in Chicago. He lives all the way in Arizona now. But I mean, I think within 6 months, he told me he's averaging around 40 right now, 40 patients. So, it's a profitable agency. That's because he works part-time marketing, because he's still doing his residencies and stuff like that. So, you can use this skill anywhere. You'll be surprised. And I've said this to a lot of times to multiple people, is that the stuff that I learned is because it was through trial and error. But I took classes in real estate sales. I took classes in car sales. I took classes in insurance sales. I took classes in because when I first got into this business, I didn't know, there was nobody training people how to sell marketing in home health. And so I literally had to learn everything from scratch. And then when I started seeing other sales trainers in this industry, I'm like, oh, this person came in. So I took some of their classes. And when I took their classes, I'm like, no. I'm like, okay, maybe I do that. But then some of the stuff that they do is like, you must have rapport with the people. And my question is like, well, how do you increase rapport? And they're like, you just have to create rapport. And I'm like, I'm like, well, how? Just like, so that's what I tell you. I'm like, listen, storytelling, this is what I do. I just reverse engineer what I do. Do other companies teaching sales and marketing in our industry good? Yeah. There's a lot of stuff that they do that's amazing. And that's my thing. My thing is just that it comes to the point, like even me, like this whole thing that we created, like it makes sense. You made sense of it. Like you said that all the videos intertwine with each other.
They really do.
And we realize that people don't see that right away. And so now we have to create the molds on how everything connects. So now we're recreating more videos and say, hey, this objection connects with that close sometimes, and like just use it together. And so now we have to create packages, say this close, that close, this close together. This is how I would deliver it. Or, so it's just, now you have to like understand that just like the people you're marketing to, you have to sometimes dumbify things a little bit for some people. There's nothing wrong with, I don't think dumbification is it's an offense for somebody. I mean, that's, we're politically correct in the US, fine, it could be offensive, whatever. But truth is this, sometimes we have to simplify things. Just like with patients, we cannot use medical terms on them. We have to actually give them layman's terms. It's the same thing. Layman's term is dumbification of, something smart like medical terms. So, that's it, man. I mean, other than that, was there anything else I can answer for you, man?
That's pretty much it for today. Was this helpful? Like, yeah, it was. Okay. For you, was it helpful for you? Like,
It's always helpful for me, because the reason why it's very helpful for me is like, it allows me to say, okay, this one works so perfect, so I can really address that more. It just helps me in regards that, what we're doing, what we're teaching does make sense for people. And it helps me improve myself as a marketer, myself as a person, is to hear things from people of what's going on. So I like to hear what's going on in the field. Is Texas different from Florida? Is Florida different from California? Right? And the truth is, it's not. Everything's the same. The only difference is the problem we have is a different payer sometimes, right? But that's that, but it's very helpful for me, just because it helps me get a constructive criticism for myself, for me as a person. When I can see you, for example, when I start saying things to you sometimes and you say, aha, that makes sense. Oh, that's perfect. Oh, I realized this happened to this and this happened to that. It just helps me confirm that I'm like, okay, great. I'm getting to people. I'm doing it right. Just like how I'm trying to present to you, it's the same thing as like, am I getting the yeses? Am I getting the presentation stuff? Am I getting the stuff that, because that's what it is. Presentation is presentation. And it allows me to make myself better, because it helps me present more. It keeps me warmed up. You'd be surprised, like if you ever try to ask me, Michael, can we do a coaching session at 7 o'clock in the morning to 10 in the morning? I'll laugh at you. I'm like, you don't want me to coach you at 7 to 10 in the morning, because you're not going to get nothing from me. I do better, training after 12, once I had maybe 5 cups of coffee in my system. Yeah. So that's it, man. So.
Well, I just realized I have nothing. I did not say anything bad. Like, just when you were telling me, like, helps me to know if it's working. Everything really is working. Like, I can't think of anything that I don't like about the program.
Yeah, and just keep on applying it, man. So what I'll do is this, just to let you know, after this is done, I have to load this video up, and if I'll load it in a private YouTube video. So it'll be set to private. That you have to use the link. You can't even like search it in YouTube, but you have to do the link. So
so they're gonna see my wonderful room. It's all crazy and stuff.
Oh, look at that. Okay. You know what? I used to have an office in my house too. Like, this is my house actually. This is my spare bedroom. So it's like my guest room that everybody so like I used to have my office and stuff like that, and then it got to the point my office became like a storage space. So when I moved to Florida to the new house, I was like, nope, I'm not having a storage. Like, I literally said, what I ended up doing was the room that was supposed to be a storage room, I ended up opening it up to the master bedroom, and I made it a little like man cave. That's it. I was like, I'm not gonna have an office. I'm gonna have a man cave. So, like in my living room, I only have a 60-inch TV, but in my man cave, I have a 90. So I'm like, and it only has one chair just for me.
Love it. I love it. So I already know that people are going to be like, oh, he makes weird faces and his room is crazy, but whatever, I like it. Whatever.
Just keep on it. And then, like I said, well, if you have any more questions, just still shoot me a text message, man. I mean, and we'll answer that. And like I said, and then we'll schedule another one, from, next month again and stuff like that, and set that up but if you have any questions, just shoot me a text message. If I'm not doing anything, I'll answer back. Okay. So that's my main goal. My cell, I still answer my text messages and stuff like that as much as possible.
Thank you. Actually,
Jacob might answer your text message though. So so you'll probably get an answer from him sometimes. But trust me, like even Jacob, I know he can answer questions correctly. He's good at what he does. He just doesn't like video.
I usually don't like video either, but whatever. Try something new. Right.
All right, so if there's anything, shoot me over, and then we'll go from there. Okay.
Sounds good.
Awesome, man. Thank you.
Thank you.
Hey, everyone. We want to be able to invite you to our 10xpatientreferrals.com, where we have our online home health marketing academy that's going to be able to help either a home health, home care, or hospice agency increase referrals, increase their census, and create a profitable company. Now, at this very moment, you're going to have access to these information through these training, marketing to physicians, how to get to hospitals, how to be able to get into nursing homes, and much, much more at a month-to-month basis with no contracts needed. It's just month to month. Now, guess what? We are offering you guys for a limited time 50% off any one of our plans. Just choose which one is going to be able to work better for you. So just stop by the 10xpatientreferrals.com at any given moment. So these are the plans that are available, whether it's the gold, the silver, or the platinum plan. Most people go for the gold plan, but it's up to you what's going to work for you. We definitely want to be able to have you come in and work with us. So here's two choices. Go to 10xpatientreferrals.com or click the link down below. Take advantage of this right now at this very moment and sign up with us. Before we continue on to the video, just need to be able to take a few seconds of your time. And so we want to be able to ask you a question. Are you looking to gain more referrals for your agency, your home health, your home care, your hospice agency? We want you to be able to join us at our online marketing bootcamp that has over 7.5 hours of training. When you actually watch our bootcamp and join our online marketing bootcamp training, you're going to get a free month access to our 10xpatientreferrals.com. So sign up for a limited time at 10xpatientreferrals.com and enjoy all the content. So let's go ahead and get back to the video that you're currently watching.